जहाँ तक मेरा ख्याल है लाइव हो गया है मैडम, नाउ स्टार्ट।
हाँ हाँ, लाइव हो गया है फेसबुक पे।
डॉक्टर शीतल जी स्टार्ट करें। यस जी, आप धन्वंतरी वंदना बजा सकते हैं शेयर करके। नमस्कार मैडम, नमस्कार।
नमस्ते।
तो ये प्रोग्राम स्टार्ट किया करते हैं, है ना। आयुष दर्पण में आप सभी का बहुत बहुत स्वागत है। और मैं डॉक्टर नवीन जोशी, फाउंडर आयुष दर्पण, आप सभी का बहुत बहुत स्वागत करता हूँ। भगवान धन्वंतरी की वंदना के बाद मैं एक पतंजलि के योग का एक सूत्र पढ़ करके इस कार्यक्रम का शुभारंभ करने के लिए आप सभी से अनुरोध करता हूँ। भगवान महर्षि पतंजलि ने योगेन चित्तस्य पदेन वासा मलम शरीरस्य तु वैद्यकेनम योपाकयुतम प्रवरम मुनीनाम पतंजलि प्रांजलि। यानी पतंजलि के इस सूत्र के साथ आप आज के कार्यक्रम का शुभारंभ करें। डॉक्टर शीतल असूदकर जी, आप इस कार्यक्रम की ऑर्गेनाइजिंग सेक्रेटरी हैं, मैं आपसे अनुरोध करता हूं, और हमारे साथ सहयोग करेंगे इसमें आयुष दर्पण की जो टेक्निकल टीम है वो आपको सहयोग करेगी। बहुत बहुत धन्यवाद।
धन्यवाद सर, बहुत बहुत धन्यवाद। A very good morning to all, each and everyone present here, all the dignitaries present in this Zoom meeting. I pay my warm regards to you, all of you at the outset only. I'm very much happy to see the galaxy of speakers present here today, who are scheduled to present their expert talks on various topics related to yoga therapy, various aspects, which is the theme of today's International Wave Conference, which we are organizing jointly. The team of Datta Meghe Ayurvedic Medical College, Nagpur, and jointly in collaboration with Ayush Darpan Foundation of India, Dehradun. We are here to celebrate the day, and today we have jointly organized the International Wave Conference here. And as we are discussing, we are moving ahead in the program. So this is a very beautiful morning. Welcome all delegates here who are present in the Zoom meeting, who are watching live this program on Ayush Darpan YouTube channel and Ayush Darpan app. I again welcome you all. Myself, Dr. Sheetal Asudkar, who is the organizing secretary of this venture. First of all, I'm thankful to Dr. Naveen Joshi ji, who has taken the initiative to collaborate with our institute in Nagpur. Again, I repeat, Datta Meghe Ayurved Medical College is our institute, and we have taken the initiative with the permission of our respected Dr. Harshala Rajurkar Sharma ma'am, who is the principal of our college. And we have our patrons, Dr. Honorable Shri Dattaji Meghe, who is the patron of our institute, our university. Our institute is the part of Maharashtra University of Health Sciences, but our management is the founder of the renowned Institute of Medical Sciences, that is Datta Meghe Institute of Medical Sciences, deemed to be university. And this college is the sister constituent college of the university, and who is under the affiliation of Maharashtra University of Health Sciences. So this collaborative venture today is presiding over here by Honorable Chairman Dr. Vashne sir. He will be joining us very shortly, and we are here today to celebrate the occasion of International Yoga Day, and so that we are here to listen to the galaxy of speakers and the practitioners, academicians, and researchers in various aspects of the yoga. Yoga needs no introduction. Everybody knows this is the ancient science of yoga, which is the part of Ayurveda also. So how it belongs to Ayurveda and other alternative system of medicines and the part of Ayush, that will be discussed under the province of today's international webinar only, and that will be under discussion by our speakers. But today we celebrate how we 6 international speakers. One of them, she has joined from Australia, all the way from Australia, Dr. Banita Sharma. Then Dr. Jaya Daptardar, she will be joining us today from USA. She will be joining in the valedictory function itself. Then Dr. Raviraj Pradesi sir, he is here, he's clinical researcher, and he has got various aspects to his personality. He is a well-known personality in the field of clinical research. Then we have Dr. Jaya Jane with us. Dr. Jane ma'am is a renowned personality again in the field of Sanskrit Sahita Siddhanta and yoga. So she has all the way joined us from Boradi, Dhule, Maharashtra. Welcome, ma'am. Then we have Dr. Vasudha Asutkar with us. She will be joining us from Pune, Maharashtra. She is assistant professor at Bharati Vidyapith Ayurveda College, deemed to be University Pune, and she has all of them. They have got their various topics to discuss their particular aspects, their particular visions about yoga therapy, and that we will be discussing in the coming part of the webinar. But what exactly International Yoga Day has got the motto, and why it is started to be celebrated all along the globe, that our students need to be having the knowledge about it. So for the students and for those who are not aware about the International Yoga Day, I will be briefing it in very short manner. National Yoga Day 2021, it will be celebrated on Monday, June 21st. And since 2015, International Yoga Day is observed on June 21st to spread the awareness among the masses about the importance of yoga and its effect on human health. The United Nations organization designated International
Dr. Sheetal, I can't hear you.
Okay. Now, is it audible?
Yeah. Yes. Yes. Yes.
Okay. I'm sorry for the internet. There was some trouble with the internet connection.
Yeah.
But now it's stable. So International Yoga Day celebrations occur all along the globe since 2015, and it has been celebrated in USA, Canada, Europe, then the Middle East, China, Australia, and some other countries of South Asia, including some part of Pakistan, even it has been stated. So it is the 7th International Yoga Day this year. We will be celebrating. And a brief history of Yoga Day: on 27th September 2014, the incumbent Prime Minister of India, Honorable Shri Narendra Modi ji, attending the annual congregation of the United Nations General Assembly, when he insisted upon the global community to acknowledge the importance of yoga as a precious asset of Indian civilization and as a blissful practice to improve human health and enrich the human mind with peace. He argued that yoga is an invaluable gift of India's ancient tradition. It embodies unity of mind and body, thought and action, restraint and fulfillment, harmony between man and nature, a holistic approach to health and well-being. It is not about exercise, but to discover the sense of oneness with yourself, the world and nature. By changing our lifestyle and creating consciousness, it can help in well-being. Let us work towards adopting an International Yoga Day. This was the argument which was made by Prime Minister Narendra Modi ji at the United Nations General Assembly. And now this year, the theme for Yoga Day is Yoga for Well-being. International Yoga Day 2021 theme is Yoga for Well-being. All the world is passing through COVID-19 pandemic, and almost every country has imposed lockdown in a certain form. In this situation, it is hard or impossible for people to remain mentally and physically fit and healthy. People are suffering from anxiety and depression, even if the lockdown is getting softer in some parts of the world. Despite that, the lockdown gets lighter. The World Health Organization reports reveal that coronavirus won't spare the world for many years. In this situation, it is risky to go outside and take part in group activities. Social distancing and a strong body immune system are the only available cures that we should embrace. So International Day of Yoga 2021 theme focuses upon telling people to stay motivated at home and adopt a healthy lifestyle by doing exercise and yoga. background of International Yoga Day in very brief. I'll be briefing to the students particularly. So yoga is around 6,000 years old physical, mental and spiritual practice that originated in India and stayed famous in many religions, including Hinduism, Buddhism and Jainism for several thousand years. It kept changing and developing with time, and then came the 19th century AD. Western colonization started taking it in Europe. Swami Vivekananda enjoyed remarkable appreciation in the eyes of the West when he traveled to Europe and then the USA as a yoga teacher. So this is the thing, and now very recently all the world is aware that Baba Ramdev is almost the brand ambassador of yoga therapy, yoga and yogic practices in India, and he has been very successful in giving fame to yoga globally. So whatever the therapeutic aspects of yoga, what are the beneficial aspects of yoga that our speakers will be discussing, but I want to emphasize on the basics of yoga, what exactly yoga means. So derived from the Sanskrit language, the word yoga refers to uniting with someone or joining or getting united. So ancient India sage Patanjali is thought to be the father of modern yoga because he is the person who codified all the aspects of yoga into a certain format and introduced Yoga Sutras. Those are very famous, and they are called as Patanjali Yoga Sutras. So now, as you know, today's theme is yoga therapy, various aspects. So what exactly yoga therapy means, what is its definition, perspective and principles, that I will be just briefing in 2 or 3 points, or you can say only 4 to 5 lines, just for the introductory part, and then the elaboration will be done by our speaker. So yoga therapy may be defined as the application of yogic principles to a particular person with the objective of achieving a particular spiritual, psychological or physiological goal, and the means employed are comprised of intelligently conceived steps that include but are not limited to the components of Ashtanga Yoga, which includes the educational teachings of Yam, Niyam, Asan, Pranayam, Pratyahar, Dharana, Dhyana and Samadhi. Also included are the application of meditation, textual study, spiritual or psychological counseling, chanting, imagery, prayer and rituals to meet the needs of the individuals. And the application of yoga therapy has got more or less three perspectives. That is the yoga to gain a sense of power, then the use of yoga to heal specific problems, such as impurities like doshas, and the third one is the use of yoga to go beyond the physical, to understand what is beyond the limited sense of self, to know the one's true self, that is witnessing the self as unchanging, witnessing presence, that is Purusha, of all that is changing, that is Prakriti. So this is called as the Adhyatmic Krama. So these are the threefold applications of yoga therapy, and the perspectives are very broad. Well, if you try to go in detail, so this is altogether a very varied type of science which will require almost say 4 to 5 years degree course to have the detailing of the knowledge of yogic science. But for the students, it is very necessary to have the practical knowledge of yoga, to know it as a science, to assimilate it as a science in your life, as well as to listen to our today's speakers, how they are successful in implicating the knowledge of yoga as therapy and its various aspects. So without wasting time, I would like to introduce our speakers for today and move ahead towards the guest lectures. And in this series, I would like to call upon our respected principal ma'am. First of all, I would pay my regards to our principal ma'am, respected Dr. Harshla Rajurkar ma'am. Ma'am, I'm very much thankful to you for giving us permission for doing the collaboration with Ayush Darpan, and for convincing the management to have this wonderful webinar. on yogic therapy, yoga therapy, various aspects. So welcome, ma'am, on this very forum of our college and Ayush Darpan collaboration.
Thank you, Sheetal ma'am. Thank you very much for your kind words. Very good, vivid description she gave about the International Yoga Day, why it is celebrated and everything. As the principal of Datta Meghe Ayurved College, I would like to tell you a few things about my college. First of all, a very warm welcome to all. And I would like to extend my thanks, my gratitude towards Dr. Naveenji Joshi as well as Dr. Sheetala Sutkar. They have organized a very well program, charted out very well. Let's see how it comes out. And I welcome all my colleagues, my teachers, doctors, my students as well. Welcome to this International Yoga Day. We are celebrating this as a International Yoga Week. And tomorrow we are going to celebrate the International Yoga Day, 7th International Yoga Day. Datta Meghe Ayurvedic Medical College, Datta Meghe Ayurvedic Medical College Hospital and Research Center is a new college, is a young college with only 3 batches of students, that is 300 students in our college. As compared to other colleges, it is very new and very young. But with the 3 batches, we are eager to achieve excellence in academics as well as research field. Meghe Group of Institution has a long history of excellence in all genres of education. Datta Meghe Ayurvedic Medical College Hospital and Research Center comes under NYSS or Nagar Yuva Shikshan Samstha, is a constitution of Meghe Institutes. Here, they have a very long history of excellence in education. And in our college, we have a 100-bedded hospital, which is very aesthetically designed as far as patients are concerned and as far as students are concerned. We have a good infrastructure. We have a very well educated and good staff with us. We focus on research. We have more than 200 publications from our college by our teachers as well as our students. We train our students, we teach our students, and we ask them to write research articles. They could be review articles, they could be research articles. We encourage them to do various projects. It is a part of curriculum. They are supposed to undergo, they are supposed to do some projects regarding medicines, regarding pharmacology, and everything they like. In yoga also, we have some projects with us. So we keep on doing such projects along with the teachers. The students are allotted one teacher, a group of students are allotted one teacher, and that teacher looks after, that doctor looks after the project. And then we come out with publications, patents. We have patents from our college. We have many research articles, as I have told you. We have a very well-established, very good herbal garden with us, with more than 200 varieties of plants. We are still developing it. We are going for various projects for herbal gardens also. Hope to get a funded project soon. We have a good boys as well as girls hostel in our campus. And so the students have the facility to stay there. We regularly organize quizzes, various competitions, curricular as well as extracurricular activities in our college. Due to this pandemic, this year we couldn't do seminars physically, but we have organized quite a lot of webinars. But this is the first of its kind, the first international webinar we are hosting along with Ayush Darpan. So welcome all, welcome to this.
Thank you so much. So kind of you. So nice of you, so nice words you have said about this webinar, and we are very much glad to have this. I'm very much proud to say on this international forum that our college is in a very good leadership. So thank you so much, ma'am. And we are very much thankful to our management even. Our inspiration, Honorable Shri Dattaji Meghe sir, then Honorable Sagarji Meghe sir, who are our mentors, our inspiration. And very nice to have, even we are very much happy to have Shri Ravidada Meghe as our guide, our mentor. And he is very much ably guiding us, and he is encouraging us, inspiring us in organizing such webinars. And this is first of its kind webinar which we are organizing in collaboration with Ayush Darpan. So I'm very much happy to have all of you here on this forum again. And I'm very much glad to have Dr. Subhash Chandra Varshney sir here today. Sir, namaste and welcome here on this forum of international webinar on yogic therapy, various aspects. Varshney sir.
Okay, thank you. Best wishes.
Yes. Thank you so much, sir. We are glad to have sir as chairperson of today's webinar, and sir will be giving his remarks in valedictory session, and he will be here all along with us today throughout this webinar. So this web conference, rather, I must say. So we will be having sir with us, and many other guests also have joined us today in this Zoom meeting, and many of others, they are watching us live on FB and YouTube link. So I welcome them in this international web conference on yogic therapy, various aspects, and we are celebrating the International Yoga Day events. And this is a joint venture which we are organizing as the Datta Meghe Ayurvedic Medical College and Ayush Darpan. So this is a joint venture, I must say. And now I would like to move ahead in this conference and move ahead to the guest lectures today. And first in the series of guest lectures today, the guest speaker is none other than our respected principal ma'am, Dr. Harshala Rajurkar Sharma ma'am. She is here with us today. Just she has completed her principal's address, and she will be moving ahead with her topic of presentation for today, that is therapeutic yoga in post-COVID-19 scenario. So she's a very good academician. She's a very good researcher. She was good in studies also. I know her since her college days. And a very brief introduction of madam I'm giving rather here, but then she is also good in administration, and she has got many other qualities to her personality. So madam has got 20 research papers to her credit. She has completed her post-graduation in Kaya Chikitsa, that is Ayurveda medicine. And she is doing research work on Uttar Basti since many days, and it is going on. She is a very good speaker also, orator and whatnot. So without wasting time, ma'am, I would like to call you in capacity of professor and head in Department of Swastharutta in our institute today. She is again a principal of the institute. So today she is here to present her views on therapeutic aspect of yoga in post-COVID-19 scenario. So over to you, ma'am.
Thank you, Sheetal. Sheetal ma'am, thank you very much. At the onset, I would like to thank the organizing secretary, Sheetal ma'am, organizing president, Dr. Naveen Ji Joshi, and also the whole team working. I know this is a teamwork to conduct a webinar or to conduct any other, even a small program. This is a very big program, particularly the international webinar, but even for a small webinar, it is a teamwork that is associated with the job. So I thank everybody in person, and then I welcome all of you. I'll start my lecture, Therapeutic Yoga in Post-COVID-19 Scenario. We will start with the prayer. Yogena chittasya padena vacha malam sharirasya cha vaidyakena. Yopakarottam pravaram muninam patanjalim pranjaliranato asmi. It is very important to go to the Almighty, to the Lord, as the country is trying to come out of the very severe second COVID wave. Nearly every family had a brush with the debilitating virus, and many members are going through slow recovery. Most people who suffered COVID-19 recovered completely within a few weeks or within a few months. But some people, even those who had mild symptoms of the diseases, continue to experience some or the other symptoms. They haven't recovered completely. This condition is called long COVID. This condition is called post-COVID symptoms they are facing. It is long COVID is described as the signs and symptoms that continue to develop after when the COVID positive test was negative, or it was also sometimes negative, but then the symptoms have developed and it extended beyond 3 to 4 weeks. According to scientific research, the prevalence is 3 to 15%. I think most of us will agree with me that when we have seen a lot of relatives, our friends who suffered with COVID-19, and out of them, many of them are complaining, unko backache hai, they have severe fatigue, they have some or the other complaint they are facing. They are not able to do their routine work as they used to do it earlier. So what is the reason and what is the solution? We are going to look at that. One more thing I would like to stress here, a positive test for COVID-19 is not a prerequisite, as I have told you. Many of them have tested negative, but then they suffered with the fever, they suffered with the sore throat, and sometimes their HRCT score was more than 10 or 12. Some of them were admitted to hospitals. I know one of my friend was admitted to hospital, but her test was always negative and she never turned positive. But even now she has some complaints of fatigue or similar like that. So long COVID, we are seeing these things nowadays. So what is the, just a minute, it is a problem. Some glitches of network issues.
Slides are visible, ma'am.
Yeah. I thought there was some, actually I had some problem.
No. Please continue.
Now we'll see what are the risk factors or what are the reasons for prolonged recovery. They could be weak or absent antibody response. We have seen this thing, everyone knows this. Relapse or reinfection of coronavirus, inflammatory and immune reactions, deconditioning or physical incompetence. I would like to stress on this point. Please mark this point, deconditioning or physical incompetence, increasing age, excess weight or obesity, mental factors. If one is not stable, if one is not happy, we saw they suffered this long COVID more than other people. So these are the reasons these we have seen. Then symptoms of long COVID. Sorry.
It is visible.
Yeah. Symptoms of long COVID, we can summarize them as there are many more symptoms beyond this. But then to summarize, we can say fatigue, chronic fatigue. I know some patients of mine, they say we just get up in the morning, we had a good sleep, but then we feel like sleeping again. We are not able to do anything. We are not in a mood even to eat something. We are not in the mood to watch the TV. This is the major complaint we have seen, fatigue. Then respiratory symptoms like breathlessness, cough, fever, they are the symptoms we are seeing in patients. Musculoskeletal features like joint pain, muscle pain, those with rheumatic arthritis, those who had rheumatic history, their pain had increased a lot. They are suffering with stiffness and other things. Neurological symptoms we are seeing like dizziness, headache, peripheral neuropathy and other things. Cardiovascular, we have seen quite a lot of patients with cardiac arrest. They lost their lives, but then they were labeled as, they were not labeled as COVID patients or COVID deaths, but they were the post-COVID patients. They had the symptoms post-COVID. Again, chest pain or tightness, heart palpitations are the common symptoms we are seeing day by day. Gastrointestinal symptoms like loss of appetite, diarrhea, nausea, vomiting, they are the patients present with these complaints. Commonly, they present with these complaints. Then the general complaints like loss of smell or loss of taste, we are seeing. Many patients have lost their weight. It is ranging from about 2 to 10 kgs. One of my patient, I know him very well. He was not obese. He was not overweight. He was just okay, or I would say a bit plump, but he lost 10 kg. He wanted to lose 4 to 5 kgs, but he was very unhappy. He was very दुखी था वो कि 10 किलो क्यों मेरा weight loss हुआ. So that is the thing we are seeing. Then psychiatric and psychological complaints we are seeing. The symptoms are like memory loss, loss of concentration. They are not able to concentrate, or sleeping problems. Insomnia is one of the major complaint patients are coming with. Also disturbed sleep. They have dreams in their sleep, bad dreams particularly, or something like that. And the depression and anxiety, that is the thing we are facing day by day. That is the main problem today, depression and anxiety. These are the symptoms of long COVID. Then about the management, if the patient is serious, if the patient is having comorbidities, if the patient is having complications, definitely we are going to take help of the hospital. We are going to hospitalize that patient and treat him accordingly. But these patients with the above symptoms can be managed pragmatically and symptomatically. We'll have to look at their complaints. We'll have to see what they are suffering with. We'll have to see how we can help them. We will have to definitely investigate for few things, but over investigations, it should be avoided. I know one of my patients, when he came to me, he said, during the COVID, his HRCT or scanning of heart was done twice for lungs scanning. It was done twice in those 15 days, but then he had breathlessness after when he tested COVID negative. Even then he had symptoms of breathlessness. His doctor, his treating doctor, asked him to do the scanning or HRCT every 3 days. This is not good. Over investigation should be avoided. I know I don't want to blame that doctor because he must be very cautious. He must be taking care of that patient. He was doing all he could do for that patient, but then exposing him for so many times is not that good. And so over investigations should be avoided. Emphasis should be on holistic approach. This I have written because I had said that the patient should be treated symptomatically, but the approach should be holistic. Ayurvedic therapies, including yoga, are playing a very important and vital role in this post-COVID scenario. Even in the cases of COVID-19, when they were positive, many Ayurvedic treatment was given. Even some yogas were advised and they helped a lot. There are many research papers saying that. So whether you are young, whether you are old, whether you are overweight or underweight or fit or unfit, whether you are COVID positive or with history of COVID-19 or suffering with long COVID, as we are, start yoga, start yoga, start doing yoga. Now, before introducing you to yoga and everything, I would like to tell you some interesting facts. An older study from 2010, it demonstrated that yoga improved mood and decreased the anxiety levels. It was a 12-week-long intervention associated with greater improvements in mood and anxiety than a metabolically matched walking exercise. It was a comparison between yoga and walking exercise. The researchers suggested that this was due to higher levels of the brain chemical gamma aminobutyric acid, GABA. GABA activity tends to be lower in people with anxiety and mood disorders. The researchers asked their patients or their disciples to do yoga for 12 weeks. They had a protocol of them. And then they concluded that the GABA levels were increased in these participants. And these GABA levels helped to improve the mood and they decreased the anxiety levels of the patients. So this was a very interesting study. Then 2017 systematic review found that yoga could definitely reduce depressive symptoms in the population at a large, but they could also reduce the symptoms in people with depressive disorders, the patients who are pregnant, postpartum women, and also the caregivers. So this was the systematic review of 2017. Other research suggests that yoga is just as effective as relieving back pain as physical therapy. I have read in the research that almost or more than 80% of the people, of all people, they suffer with backache some or the other time in their lifetime. So this is a very big problem and people are taking a lots of medicines, NSAID or other medicines. They are getting surgeries done. They are taking medicines for years together. Why not give a try to yoga? So these researchers had said yoga is as effective as other medicines in relieving back pain. Research suggests that yoga may lower symptoms of depression by reducing cortisol or the stress hormone. Then what is the role of yoga? I would like to explain you in a brief manner, that is to appreciate the role of stress in disease and of relaxation process, of course, in the recovery, relaxation as well as stress. It's important to understand the autonomic nervous system. This autonomic nervous system controls the function of heart, liver, and also other organs, all internal organs. There are two branches working in conjugation under autonomic nervous system. They are sympathetic nervous system and parasympathetic nervous system. The sympathetic nervous system is in conjugation with the stress hormone, adrenaline and cortisol, and it initiates series of changes in the various levels of blood pressure, heart rate, sugar levels. The adrenaline and cortisol raises the blood pressure, heart rate. This means more energy and more blood and oxygen is flowing towards the large muscles like trunks, arms, and legs. This blood is reduced in the organs like reproductive system as well as digestive system. This situation is termed as fight or flight response. When this sympathetic nervous system is acting, it is the levels of cortisol and other stress hormones is raised. Whereas in contrast, the parasympathetic nervous system tends to slow the heart and lower the blood pressure, allowing recovery after a stress event. These are called as restorative functions, and here they help in rest and digestion. They help during rest and digestion. Yoga include stepwise asana and slow breathing and meditation also. So here PNS or parasympathetic nervous system is activated and it leads to mental relaxation. Whereas the sympathetic nervous system, it tends to increase the heart rate and blood pressure, and it activates, it gives a push to activation. Yoga include, that is, then again, yoga include asana with vigorous sun salutations and Kapalbhati like breathing. This activates the sympathetic nervous system. So the activities, when you perform yoga, you perform sun salutations, you perform other asanas along with pranayam, that is like Kapalbhati, as well as Sitali pranayam, as well as Anulom Vilom. Then together, the action is great. Together, the action is the expected one. More active yoga practices, that is combination of all, followed by more active yoga practices, followed by relaxing ones, gives deeper relaxation. This is a scientifically proved data, and research. This is a research work from Bangalore. Then when we define yoga, or when the general public, or when we ask the patient to do yoga, they generally start with asana. Yoga means asana and pranayam, but that is not the thing. The classical yoga or the yoga is defined as Ashtanga Yoga. Sage Patanjali had described it under 8 limbs, that is Ashtanga Yoga or Raj Yoga. The Ashtanga Yoga of Sage Patanjali is as follows. It has 8 components. The first one is Yam, that is the principles or moral code. These are the principles, they should be followed. These are the social principles. These are the moral codes like Asatya, Ahimsa. One should follow all these things. Then the Niyam, they are the personal disciplines. Everyone should follow these Niyam. These are Shauch, Ishwar Pranidhan and everything. So you are supposed to follow Yam and Niyam, and then you should go for asana. If you follow the Yam and Niyam, then only you will get the total effect of yoga. And so asana are the yoga poses or yoga postures. We will talk about it later. Then pranayam, as everyone knows, yogic breathing or extension and control of breath. Then something went wrong. Then the 5th one is pratyahar, a mental preparation to increase the power of mind, or it is the withdrawal of senses. We'll have to withdraw our mind from the senses, but then we'll have to concentrate in ourselves. We'll have to look inside, that is pratyahar. Then dharana is the concentration of mind on one subject, one object or its field, or fixing the attention on a single object. I know one guy, he said, I used to do dharana already. He used to, even that is okay. I'm not saying that is wrong, but that is not the only meaning of dharana, putting one object or one coin in front of you and looking at it for minutes together. The meaning of dharana is much more than that. It is concentration of mind. It is concentration in a one particular field. It is setting your goal. It is following your goal. It is the dharana. Then dhyan or meditation, or withdrawing mind from all external things and focusing on one point that is dhyan, or we can call it meditation. Everyone knows meditation today. And samadhi, or salvation, or state of super bliss, joy, and merging of Jivatma and Paramatma. So this is all about Ashtanga Yoga. So when we talk about yoga, asana and pranayama is not the only thing. Today, as we are seeing, we are living in the post-COVID world, or we are living with COVID-19. The most important or most talked words after COVID-19 or coronavirus are yoga and pranayama. I think everyone will agree with me with that. So everyone knows yoga and pranayama. What are the benefits of it? I'm going to say it in very briefly. According to scientific research, yoga improves strength, balance, and flexibility. It reduces stress, anxiety, and helps in managing depression. As I have told you earlier, it helps in back pain as well as other pains of our body. It helps prevent heart diseases. It stimulates brain functions. To summarize, we can say yoga can mean more energy and brighter moods and improvement in quality of life. When I ask my patients to do yogasanas or pranayam, after a few days when they come to me, they say, Ki, we are feeling more energetic. We used to get tired in the evening. We used to feel like doing nothing in the evening. But since we have started yogasana and pranayam, they are helping us a lot. We are feeling more energetic. So these are the benefits of yoga. And about the history, when we are going to look at the therapeutic part, one thing I would like to tell you here is about the history. A systematic review found that lung function abnormalities, psychological impairment, and reduced exercise capacity were reported in people suffered with SARS and MERS up to 6 months after hospital discharge. One study found a significant impairment in exercise capacity even after 2 years when they had suffered with SARS. One more study revealed that 40% of people who recovered from SARS suffered fatigue symptoms almost 3.5 years later when they were diagnosed with SARS. But then, what is the therapy? Is it same? As COVID-19 is a new disease, scientists are unsure about the effects months or years after the initial illness. What will be the prognosis? What will be the therapy? What will be the treatment? What will be the outcome? They are not sure. So the SARS, MERS, and COVID-19 are caused by viruses from the same family. These 3 diseases are from the virus, are caused by the virus of same family. Though they are different from each other, they are similar in certain things. So we can conclude the recovery and rehabilitation could be similar. It could be different, we never know. But then we will follow that therapy, we will follow on that lines, and we'll say that the recovery and rehabilitation could be similar. Exercise in the form of yoga should be undertaken cautiously. That is because there shouldn't be any problem later on, and it should be cut back if the patient develops any symptoms, adverse symptoms. Therapeutic yoga, as I have told earlier, yam and niyam should be followed meticulously. Asana, there are various asanas. They strengthen your body, they strengthen your mind, they increase your immunity and take away your fatigue. So the various asanas, I think all asanas are available on internet and everywhere, in all books and everywhere. So I'm going to just mention the name of it. In standing postures, Tadasana, Padahastasana, Ardha Chakrasana, and Trikonasana. They help a lot. There are research papers saying Trikonasana help to improve the fibrosis of lungs. It helped in breathlessness. Then asanas in sitting postures, Bhadrasan, Ardha Ushtrasan, Shashankasan, and Vakrasan. Shashankasan is a very good asana. It helps to relieve the anxiety. It helps in depression. In prone postures, Bhujangasan, Shalabhasan, and Makarasan. The prone posture, it was a new word earlier for the layman. Of course, the doctors know prone position and everything, but it was a new word for general public. But now everyone knows, because all the doctors, even in the hospitals, they ask the COVID-19 patients to sleep in prone position. So these asanas, they definitely help to expand the lungs, to expand the oxygen taking capacity of lungs. Asanas in supine postures are Setu Bandha Asana, Uttan Padasana, Ardha Halasana, Pavan Muktasana, and Shavasana. I think this is the favorite asana, Shavasana, of all people, but Shavasana should be done only after doing all other asanas. Then we'll come to pranayam. Pranayam improves blood circulation, allowing more oxygen to be carried, and this oxygen to be carried more efficiently to the lungs. So pranayam, one should include following pranayam in their post-COVID routine. Everyone should start with a few repetitions of pranayam, but they could be increased over a period of time. One of my very close relative was suffering with COVID-19. His HRCT score was 16. He was given all the medicines and he was taking Ayurvedic as well as allopathic medicines. But then we were a bit worried. We went to the pulmonologist. He's a very renowned, very famous pulmonologist. He told, "Aap dawaiya to lo, but start doing pranayam." My relative, the patient, he said, "I can't do for pranayam for more than 2 or 3 minutes." He said, "It's okay. Do it till you get tired. Do pranayam all over the day, at least 10 to 20 times a day, Anulom Vilom. Let it be for 2 minutes, let it be for a minute, but do pranayam." He is a very renowned pulmonologist, and he's working in a very good hospital here. So which pranayam you can do? They are Anulom Vilom, Brahmari, Bhastrika, Nadi Shodhan pranayam, Sitali pranayam, and Kapalbhati. Again, we know all this pranayam thanks to Mr. Ramdev Babaji. उन्होंने हम सबको ये सिखा दिया है. Kapalbhati will help you to reduce your weight too. Kapalbhati will help you to reduce your belly. I think this will help many people to attract to do Kapalbhati. But then it helps in post-COVID scenario. And Kapalbhati is forceful expiration, or sending out or taking out the oxygen from body forcefully. Forceful exhalation by contracting the abdominal muscles. Then dhyan, dharana, dhyan, and samadhi. The dhyan in Shambhavi mudra, or meditation for stress, it helps in deep relaxation and silencing of the mind. Meditation, everyone knows, it is, some people, they say it is a very difficult procedure. How can we do meditation? We are not able to concentrate. We are not able to think of worldly, stop thinking of worldly matters or something like that. But then the easy method, the easy thing is pray your deity, pray your God. Whoever you think is the superpower who is controlling, pray to him, close your eyes, think about him, and that is meditation. Meditation will be pivotal in your recovery process as it helps the body achieve a relaxed, sleep-like state. Yeah, you are not going to sleep, but it is a sleep-like state which promotes healing, recovery, and regeneration. Yeah, it helps in regeneration. There are research works, they say that fibrosis of lungs is converted, and it is the lungs are more viable after doing meditation, after doing yoga. Setting positive affirmations. Yeah, this thing is also very important. Setting positive affirmations, mentally chanting a mantra, praying to a deity, creating a healthy and happy vision of yourself will find a way to calm and relax state of mind. Making others happy is a very good thing, but it is only possible if you are happy at your state. If you are feeling happy yourself, then only you can make other people happy. So try to be happy, try to be contented, try to be, and then help others. And then. So to conclude, the novel coronavirus disease, that is the COVID-19, has been a greatest challenges ever faced by human beings. This is the greatest challenge. We have seen in movies, many movies, there is some kind of invasion by extraterrestrial or other people, and somehow we come out of it, or we had a great difficulty facing it. But then I think this is the greatest challenge faced by us. The pandemic is taking lives of thousands of people by each passing day. And the post-COVID scenario is also not good. We are daily seeing someone is losing his or her life, or someone is facing many health problems. All the countries are slowly trying to get back to the new normal. So the emphasis on physical and mental health is more today than ever before. We'll have to take care of our health, physical as well as mental. And so what is the solution? Yoga. Yoga is the only solution. As we spell it, Y-O-G-A, yoga. But then it is the yoga. It is fondly called as yoga, but it is the yoga we should call it. And it is the ancient physical, mental, spiritual practice that originated in India. It is almost 3,000 to 5,000 years back. There are depictions in Rig Veda as well as various Upanishads about yoga. And this yoga will definitely give us a hope and pave the way to get through this into a very bright future. Tathastu. Thank you very much. Thank you.
Thank you. Thank you very much, Harshala ma'am, for a very nice elaborative talk on the management of COVID-19 patients, particularly the post-COVID-19 scenario with the help of yoga and pranayam. So you have very nicely elaborated how yoga and pranayam can be a solution to the n number of problems which are faced by COVID-19 patients after getting the treatment protocol has been established, and whatever treatment protocols are designed rather by the physicians on their own, and they are given to the patients on somewhat like a trial and error basis in some hospitals, or whatever say permutations, combinations these people they are doing. And because it is a very, as you have very well said, that it is a challenging task to manage the COVID-19 patients, and due to that only they have emerged with new and new protocols, ever changing protocols. And how yoga and pranayam can be a solution, you have very nicely stated in your
Sheetal ma'am can't hear you.
Sheetal ma'am, there is some problem in the connectivity, I suppose. Vanita ma'am, you unmute your mic.
Sorry.
Right.
Yeah.
So I was not able to hear. Sheetal ma'am,
Yeah.
I think
I think she will be back, like
Yeah.
probably because she left, like I saw. She's trying to
she must be
reconnect. Probably.
reconnecting.
Yeah.
Hello, everybody. I think Sheetal ma'am is, there is some network issue or something like that. But the schedule of the program she had sent me, shall we start with the other lecture? It would be better, I think.
Yes, please continue.
Ha.
Yes, ma'am, please continue.
Yes.
Dr. Naveen ji, are you there?
वो हम लोग-
Is there someone from Ayush Darpan?
Yes, ma'am. Yes, ma'am.
Actually, Sheetal ma'am got disconnected. There may be some issue. She will join soon. But we will continue with our program as scheduled. Shall we?
Okay, ma'am.
Actually, I think after my lecture, the program she had said me, we have a lecture of Dr. Neeru Nathani on yoga and diet for management of metabolic syndrome. But I'm sorry, ma'am, I don't have your, to introduce you, I don't know anything about you, but then I have got the name and the topic. So you give a brief introduction of yourself so that when Sheetal ma'am will join, she will tell us more about you, but you better give a brief introduction of yourself and we can start with the lecture. Dr. Neeru Nathani, ma'am.
Thanks a lot, ma'am. Myself, Professor Neeru Nathani, HOD in Swasthvrit and Yoga, Faculty of Ayurveda, Institute of Medical Sciences, Banaras Hindu University. I had 18 years of teaching experience, and under my supervision, MD and PhD students are also, along with UG scholars. And first of all, from the very beginning, I want to congratulate your team and of college, Datta Meghe Ayurvedic College. You did a lot work to organize this international seminar webinar. It's looking like this and very much successful. And I am thankful to the all organizing team of college and Ayush Darpan also. So, am I audible, ma'am? Yes. Hello.
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Okay,
Yes.
okay.
Very
So I am thankful to the organizers for giving me this opportunity to share my knowledge and share my views about some therapeutic aspects of yoga. So I have chosen the topic, the effect of yoga and diet on metabolic syndrome. So I think I wish to share my PPT. Could I
Yes,
share?
ma'am.
Could I share? Okay.
शेयर स्क्रीन कर लीजिएगा मैम.
Yes. Is it visible?
Yes, ma'am.
Okay. So I am welcoming Professor Sheetal ma'am also.
Yes, namaste ma'am and sorry for the interruption. मेरी
Yes.
तरफ से थोड़ा
No
सा
problem.
नेटवर्क इशू हो गया था. Sorry,
Network की
sorry.
वजह से ये सब चलता है. No problem.
मैंने मैडम को मैंने ही बोला हम शुरू करते हैं.
So nice of you, ma'am. Ma'am, because मतलब unprecedented कुछ चीजें हो जाती हैं.
Exactly.
So thank you so much. Please continue, ma'am.
Yes. All audience and participants get benefited by the knowledgeable lecture of Professor Harshla Madam. And as I just, I know that he is the professor in Swasthrit and Yoga. Is it so? She is the professor in Swasthrit, I think.
Yeah,
Yes,
ma'am.
as you told.
Yeah.
So with this webinar, I get connected with the galaxies of Swasthrit also. And first of all, I would like to pay my regards to Professor S.C. Vashne sir. He is my senior in BHU, and he is a very good senior of mine, and always bless me. So I am thankful to Vashne sir also, and on this occasion, I am going to present this topic as showing on a screen. And about the International Yoga Day, Dr. Sheetal has detailed very much and beautifully. So I am not going to repeat this. Just International Yoga Day is being organized since 2015. So this is nowadays we are celebrating the 7th International Day of Yoga, and on this occasion, the theme of Ministry of Ayush is "Be with Yoga and Be at Home" in view of COVID-19 pandemic. So we have to counter the effects of viral infection by improving immunity and to stay overall healthy, to slow down the spread of COVID-19, to balance the psychosomatic health. So about these points, Professor Harshla Madam has given details along with scientific studies also. So my work is become light. I am going to my topic directly, and this is my topic because metabolic syndrome is a very much common problem nowadays, and it is a group of 3 problems like blood pressure and hyperglycemia and central obesity. So these 3 diseases are prone by the metabolic syndrome. If metabolic syndrome is there, then patient will as early as goes to complications of these diseases. Hence, in the early stage, we have to prevent this disease by lifestyle, healthy lifestyle like food, so proper sleep, and yogic practices also. So here I will share my knowledge about this topic, and whatever the research also done on this topic in my department under my supervision also. So I will share under these headings. Here I am telling that metabolic syndrome is the condition having any 3 of 5 following medical conditions like abdominal or central obesity, elevated blood pressure, then elevated fasting plasma glucose or high serum triglycerides, and low density cholesterol or HDL, and low level of HDL. So any 3 of these 5 may be positive, then the candidate will be supposed to be of metabolic syndrome. And this abnormal obesity and insulin resistant are main underlying abnormalities in metabolic syndrome. And the physical inactivity, overeating, hormonal imbalance, no doubt, and sedentary lifestyle, aging, and high calorie diet are important factors for the pathogenesis of metabolic syndrome. And nowadays, in case of pandemic, a lot of stress is there, and people are inside home. They're not able to do so much physical activities. So this in this scenario, this problem is more prevalent, becoming more prevalent, along with other no doubt other complications of COVID-19. And these are the diagnostic criteria I wish to share to the audience. That if the patient having range of following components like waist circumference more than 90 centimeter for men and more than 80 centimeter for women, and 2 or more of the following criteria may be present out of these 4, like BP 132, 159 millimeter of mercury systolic, or 85 to 100 millimeter diastolic, that is in the range of pre-hypertension or grade 1 category. And fasting triglyceride, if touches between 150 to 250 ml per dl, then fasting glucose 100 mg per dl to 160 mg per dl, and that is under the category of impaired insulin resistance. And HDL will be low, that is 30 milligram per dl to 40 milligram per dl for men, and 40 to 50 milligram per dl for women. If any three of these criteria will be positive, then diagnosis will be confirmed. Then now we come to the management part of this disease. As we all know that the conventional approach for the management involves lifestyle interventions and use of drugs like hypoglycemic, hypolipidemic, antihypertensives. However, these approaches of modern therapy have several long-term and short-term adverse effects also. Therefore, the highly evolved holistic approach of Ayurvedic therapy and yoga therapy could explore the possibilities, and various scientific researches also prove that they have they are more important to manage this problem. Now we come to the principles of management. No doubt these are the principles of management for any disease also, and especially in case of metabolic syndrome, I am referring here that Nidan Parivarjan or avoidance of causative factors is the first foremost principle to manage any disease, that is either in the stage of prevention, or in the case of either in the stage of primary prevention, that is before the disease occurs, and in the stage of secondary prevention also when the disease occurred. So Nidan Parivarjan is first one, and if we remove the causative factors, then there is no need of treatment. And another one is Pathya Ahara, or wholesome diet is must for every individual, because without diet we can't get benefited by the medicines totally, because it is beautifully written at Pathe Sati Gadartasya Kim Aushad Nishevne, Pathe Asati Gadartasya Kim Aushad Nishevne. This is the beautiful verse by Pandit Lolim Rajji, and it indicates that the importance of Pathe Ahar in our daily routine. And Vihar is also important, including physical exercises and proper sleep also. It's important to manage any disease, and especially metabolic syndrome also. And specific treatment with some medicines, modern, either maybe modern medicine or Ayurvedic medicines. And no doubt yoga is also very much important component for the principle of management of any disease. So now we come to the diet part. First, now we come to the diet part of management. This is the verse of Srimad Bhagavad Gita. Ayu Sattva Balarogi Sukh Priti Vivardhana Rasya Snigdha Hridya Ahara Satvik Priya. So these are the characteristics of Sattvic diet, which mainly Sattvic food should be taken. That is food which gives lightness, alertness, energy, and create a clear consciousness also. Sukh Priti Vivardhana, and it is Rasya, Madhur, Snigdha, and Hridya also. So these are the qualities of Sattvic diet, which should be taken by a individual to balance the doshas in our body, either Sharik doshas or Mansik doshas. And Mitahar is also important for the individuals to balance the digestive power of individuals, so that doshas will also be balanced. And now we come to the different specific pathya that should be advised to the patients of metabolic syndrome. In the early stage also, they can prevent the disease by observing these pathya and apathya. Especially in this table, I have noted only the dietary pathya and apathya, although pathya and apathya include diet and ahar and vihar both. But here I have listed the dietary portion also only. Like this, under the category of cereals like barley, jowar, wheat, maize, and sama chawal is also very good for metabolic syndrome cases. And rice products and naveen anna are contraindicated. Anna or food grains like of less than 1 year old, they are not good for patients. That increase the obesity and may also in the body. So next is another category of pulses. Green gram or mudg is very good. Then masoor, then horse gram and chickpea black are indicated. And under the apatyahar, peas and black gram or mash dal is contraindicated because it is cough medhar, vardhak also. So it is contraindicated, black gram. And under the category of vegetables, green vegetables and fenugreek, methi, and loofah, gourd, then bitter gourd, brinjal, and these are beneficial for because they contain the fibrous fibers also, so that metabolism will become normal. And potato or other tuberous vegetables are contraindicated. And under the heading of fruits, jambul, pomegranate, papaya, carrot, and guava are beneficial. And so much sweet fruits like mango, grapes, berry, etc. are contraindicated. And under the heading of beverages, takra, ushna jal, or soup of vegetables are indicated. And however, curd is contraindicated because it is abhishandi and increases the med also. So it is contraindicated. And excessive use of milk is also not good. And sugarcane products are contraindicated. And under the category of some other groups, like items like garlic, curcuma, and amalki are good for these patients. However, non-vegetarian food difficult to digest are not good for patients of metabolic syndrome or patients of obesity also, because obese patients are more prone to become the patients of metabolic syndrome. So in the early stage, in the stage of central obesity, we can use we can advise these pathe and apathe from the very beginning to prevent the occurrence of metabolic syndrome. And apart from this, common pathe and apathe for every individuals, in our research, we chosen 5 food items to prepare the flour of these items, and advised to take the patients daily. Apart from the flour of only wheat, we have added these 5 items: barley, wheat, green mudg, and chanak, and sawa chawal. These 5 items are collected and in equal quantities, and mixed flour was used to make the chapatis or any halwa, etc., to advise to the patients. So after this 3-month study, we got very good results. In coming slides, I will show. And now we come. This is about the pathe ahar. Pathe ahar, general pathe, and then specific pathe ahar for metabolic syndrome cases, which is proven by research also. And now we come to the yoga portion of this presentation. Under this heading, this is all about general introduction of yoga, which has been covered by Professor Sheetal Madam and Professor Harshla Madam. So I am going to next slide. This is about, yes, of course, as Madam said, that yoga is not only the some asanas and pranayam, or pranayam is not only the practice of this Kapalbhati, because Kapalbhati is a part of Shat Karma. So this is the practice of, by the practice of abdominal movements, we do the Kapalbhati. So this is not under the heading of pranayam. And by the practice of Kapalbhati, we manage our digestive power. And as we know that अग्नि के आधार पर ही सभी बीमारियां होती हैं, तो अग्नि को हमें बैलेंस करना है, दोषों को बैलेंस करना है. We have to balance our doshas and agni. So Kapalbhati is good to improve our digestive power. And before doing asanas and pranayam, we have to practice yam and niyam in daily routine also. These are not the practices to do for few minutes in a day. These are the practices under the heading of yam and niyam, which have to be practiced in our life. These should be the part and parcel of our daily routine and our habits also, like yam, ahimsa, satya, stay, brahmacharya, and aparigraha, and Shauch, Santosh, Tap, Swadhyay, and Ishwar Pranidhan. These should be the part and parcel of our daily routine, like we are taking bath daily. Similarly, in our daily routine, these should be the components of our lifestyle. And by practicing this, our code of conduct become good, then mind becomes stable, then this will be helpful to concentrate our mind during asana, pranayama, and during meditation. So if we practice yam in our life and practice niyam in our life, then the disturbance from outer world become less, and we will be proceed easily in the stage of dhyan or meditation very well, to concentrate and to concentrate the indriyas also, and to control the panch indriyas also in pratyahar. These will be beneficial, like yam and niyam. So this is about Ashtanga Yoga, and no doubt yam, niyam, asana, and pranayam, these are the sequences. And so after doing asana and pranayam, if meditation is not done, then it is also again incomplete, because without meditation, the complete effect of yoga is not will be there. So we have to advise the candidates to take this package of yoga, beautiful package of yoga, all limbs of yoga to be adopted in toto. And now we come to the specific yogic practices beneficial in case of this metabolic syndrome. So before going to do any yam, as I've told that yam niyam should be done every day for 24 hours, and after that asana may be practiced morning and evening empty stomach. And before asanas, we have to advise some joint movements of every joint, so that joints will be relaxed and their circulation will be improved, so that in case of asanas we can sit in the stable state, sthir sukham asana, in a stable state for long duration, to concentrate our breath or our pran in case in further step of pranayama also. So these are the joint movements of every joint of our body, from the lower limb to upper limb and of neck also. And after that, the asanas prescribed in our research work were like Trikonasana, 5 rounds for 5 minutes, around 5 minutes. The rounds are fixed and around 5 minutes were tell. And then Ardha Matsyendrasana 5 rounds, then Mandukasana for 5 rounds. These are the postures advised. Then Makarasana for 5 minutes and Naukasana. So these set of 5 asanas were advised. And last one is Shavasana. After doing this, Shavasana is must, as madam also told. So this set of 6 asanas were advised for the research work, and we got very good results. And under the heading of pranayam, Nadi Shodhan pranayam or Anulom Vilom was advised for 10 rounds or about 5 minutes. And Bhramri pranayam for relaxation to remove the stress also. So for about 10 rounds or 5 minutes. And next is dhyan, to continuous holding of one's mind on particular subject, either inside our body or like Shat chakras, any chakra of our body, or any lord outside the world, outside the body. You can concentrate on any particular subject, and depending upon the availability of time, and minimum 15 minutes or half an hour is must to concentrate the mind and to control the mind. So this is about the dhyan. And here I am showing some these pictures of these 5 asanas and 6 asanas, like Trikonasana. No doubt Trikonasana is simple one, and this is Tiryak Trikonasana. In this picture I am showing Tiryak Trikonasana. It gives double benefit, because turning and twisting both is there in this. So central obesity will be removed. And this is Kati Chakrasana. This is also twisting also, and good for appetite, and good for digestive power, and good for abdominal fat also. So here we have chosen the same asanas which are directly affected on abdominal cavity and abdominal organs. Like this is Ardha Matsyendrasana and this is Mandukasana. These are the asanas of choice for diabetes also. So we had chosen these asanas for sitting position, and this Makarasana and Dhanurasana, and that one is Naukasana and Shavasana. So here I have shown the pictures of these. This Naukasana is also good for removal of central obesity. So these asanas have direct effect on digestive power. Hello. Hello. Please unmute your mics. Please mute your mics. So these are the asanas in lying down supine position, and after the practice of these yogic postures and advice of this particular diet, we got wonderful results in the improvements in the following parameters like waist circumference, body mass index, systolic blood pressure, diastolic blood pressure, fasting blood sugar, fasting triglyceride, and HDL also. So these parameters get improved after the practice of these yogasanas and use of this particular specific diet of food items of 5 grains, flour of 5 grains. So now this is about the diet and yogic practices which are beneficial directly to the metabolic syndrome. And now I am concluding that various researches also prove that yoga promotes physical, mental, emotional, social, and spiritual well-being. Various material, lot of material is available on the net about the yoga practices and their effect, and in scientific journals also that researches are published. So there is no doubt about it, the effect of this yoga and diet. And dietary advice is a major part of every prescription also, because without dietary advice, the effect of either yoga or effect of any medicine is not total, not get totally. And yoga and diet employs a broad holistic approach towards the right lifestyle, for healing effect, then positive way of thinking and way of being in the world with disease-free state. So we have to follow proper diet, and we have to know about the dietary components according to our Mool Prakriti also, and according to season, according to Ritu also. So we have to manage the dietary food items as per availability in the season. In that season, we should not use the preserved foods, and we should not use the curd in for whole 12 months in the year. For curd also, there is specific indication and contraindication in 6 seasons that should be followed. This is about conclusion. And now we can say that yoga and healthy diet should be incorporated from very beginning of life to prevent and control the diseases, and especially metabolic syndrome. Here are a list of some researches done in our department. No doubt researches on the net are too much, so you can see there, but I am highlighting the researches done in our department about the effect of yoga and diet on different non-communicable diseases like hypertension, diabetes mellitus, kidney bar psoriasis, and pregnancy outcome also, then Ardha Bhedaka migraine. So on these diseases, different food items were selected according to Ayurvedic text, according to their Gun Karma. We have selected the food items and advised to the patients, and studies were done under the MD courses for 3 months, and we got very good results as listed in as their benefits are listed in the Ayurvedic text, that these food items are beneficial because of these food good qualities, gun and karma. So we have chosen according to that one. And this is the same research what I have told now. Effect of lifestyle modification as special pathya ahar and yogic practices with a special reference to on metabolic syndrome, and on obesity also these food items were used and tried and got good results. And in primary dysmenorrhea also specific yogic practices and lifestyle got good results in their quality of life of adolescent girls. So these are brief about some researches done under our supervision in my department. And lastly, I welcome to the audience whosoever is present in the Varanasi about the lifestyle and yoga session from 7 a.m. to 8 a.m. in Patanjali Yoga Hall of the department. But I want to emphasize that nowadays, due to COVID-19 pandemic, this activity is not regular. No doubt after when this era will go on, then we will again assemble there to give the benefits to the community about the healthy lifestyle and yoga practices for their well-being. So once again, I want to thank to the organizers and all team for giving me this opportunity. Thank Thanks and thanks to all.
Thank you. Thank you so much, Dr. Neeru Nathani, ma'am, for such a wonderful lecture on management of metabolic syndrome with the help of yoga, pranayam, and the dietary regimen, whatever you have recommended in your lecture, beautiful lecture. Madam is the Institute of Medical Sciences, Banaras Hindu University, and it's no wonder that, ma'am, your name has been suggested by the stalwarts of the field of Ayurveda, seniors in the field of Ayurveda, for today's International Web Conference of our. It is just because of the work you have done in the field of diet and yoga and Swasthvrutta. And I guess to have all these things from the master himself and in the matters a lot. We would like to hear you in details on some other occasion, and we would like to invite you on this forum or such a forum again whenever we get a chance, and have details of your study and researches, whatever you are doing in the field of yoga, meditation, diet, and Swasthvrutta lifestyle management and everything. So thank you so much, ma'am, for being here today. And it is well said that yoga is a light which once lit will never dim. The better you practice, the better the flame. This is well said by BKS Iyengar, the very recent yoga guru in India. And it is very well applicable to the state of yoga and the way it is emerging as a life science, as a healing process, as a healer, one can say. And it is rather, we can say, it is a torch bearer for us, for the say public health community. It is from the ocean of knowledge of from the Ayush department, we can say. So thank you, ma'am. And moving ahead, we have with us today our third speaker, a very well-known speaker she is, and it has been a very pleasure to have with us today Dr. Vanita Sharma. Dr. Vanita, ma'am. Dr. Vanita, are you here?
Namaste, Sheetalji, Professor Sheetal.
Yes,
thank you.
Thank
Yes,
you.
I
Thank
am
you so
here.
much. Yes, Vanita, ma'am, namaste. Welcome. You are most welcome here on this very forum of our International Web Conference on yoga therapy, various aspects. So I welcome you here, and this has been a very long time that we have been interacting on various topics, but due to some or the other reason, Vanita couldn't join us in those days. But now today she is with us, and she is a very well-known name in the field of Ayurveda abroad in Australia. So I would like to introduce Dr. Vanita to our forum, to our speakers, to our audiences, our researchers in brief. So Dr. Vanita Sharma, she is a entrepreneur. She is a traditional Ayurveda doctor and prolific writer. Dr. Vanita Sharma needs no introduction in Australia. It wouldn't be amiss to call her the face of Ayurveda in Australia, as many follow her advice and guidance to deal with chronic illnesses and conditions. Dr. Vanita Sharma, a change agent, has devoted her multifaceted expertise to helping people live a better and healthier scenario. An acclaimed thought leader in the domain of Ayurveda, Dr. Vanita Sharma is a fifth generation Indian integrative Ayurveda doctor who brings with her the wealth of legacy and experience through her family's practice in India. Her venture Vibe Ayurveda in Melbourne, Australia, offers a huge spectrum of holistic health services and traditional Ayurvedic from across the southern hemisphere. In addition to this, she has single-handedly facilitated an international collaboration with Australia, India, Europe, Brazil, North America, etc. through their respective health and preventive care. She has been playing a key role in revolutionizing the global healthcare landscape for over a decade now. Her pioneering work in this domain has transformed many patients' health and lifestyle for better, and also won her the IABCA 2018 Women of the Year Award, and for the Association of Ayurveda, and is currently to you. So I would like to call upon you without wasting more time, and it has been a pleasure to have you here. So today, Dr. Vanita ma'am is with us to present her views, her perspective on Mauna meditation, that is consciousness, the power of silence. So over to you, Vanita.
I'm just trying to share my screen. Just give me.
Ma'am, your voice is echoing a lot.
Okay, just a second.
Is it okay now?
Yeah, like I'm just like trying to open.
Okay, okay.
Can everyone see the slide?
No, the slides are not visible. You have to share it. Share screen is the option.
No, we are able to see your screen, but slides are not yet opened by you, I guess.
Oh,
Yes.
okay.
You have to move ahead.
I'm just trying to.
Yes. Now they are opening. They're opening
Yeah?
now.
Okay.
Yes, please zoom out it. Zoom it out.
Zoom out.
Maximize.
I'm just like.
Fine, now you just need to maximize it.
Yeah. Is that okay?
Not yet. It is visible, but it can be better. Now it seems it's better now. Yes.
Yeah. Can I start?
Yes, yes.
Yes.
Just make sure your slides are moving.
Yeah, like they will. Is that okay?
Just go in front of 2 or 3 slides, you move ahead and then you come back. I guess then it will be sure. Yeah.
Is that okay?
Yeah. Okay. Please continue.
Okay, thank you. Thank you very much, like everyone. And sorry for taking time, like just to get the internet and everything, because I didn't wanted it to get obstructed. So can everyone hear me?
Yeah, yeah. Yes, Dr.
Yeah,
Vanita.
yeah, okay. All right. Okay, yeah. So the sound was echoing. Well, I just wanted to thank you, first of all, Ayush Darpan and Professor Sheetal and everyone else to give me an opportunity to be part of the celebration today, just on the occasion of International Yoga Day. And I came on the screen after quite a long time, like it was just as we are all aware for the catastrophe that's happening throughout the world. And I am glad that it's kind of controlled and being managed wherever best possible it can be, like even across wherever worldwide. And in India, Australia, I am in this part of the world where we had various lockdowns, and we did like a lot of like webinars through Ayush Darpan. And I thank you, especially all the dignitaries who are present today. And I really enjoyed the conversation, and especially like the topics like for today with the yoga diet by professors who are much more senior and experienced and qualified as compared to myself, like because I myself like started practicing in Australia about 23 years back, and even like as a Ayurveda physician, but then I am even working on a voluntary role with the Department of Education as a deputy chair for complementary health and skills IQ, and as well as like I did accomplish quite a few awards, like as in Business Woman of the Year, Woman Entrepreneur, Women Achievers Award, like, and I did accomplish like a Community Services Award in the last 3 years. And I really feel privileged to be part of my homeland, India, to celebrate the occasion of yoga. So I really thankful even to Professor Sheetal. She just like contacted me to be able to, if I can participate or not, and which I feel is an honor for myself, like to be part among like all these experienced, like our experienced practitioners in yoga, diet, Ayurveda, and it's all about the lifestyle and everything. So I'm going to present today, not talking too much further, like about Maun Sadhana, the silence. So I'm going to discuss about the power of the silence, which is the Maun. We always call like a Maun Vrata, the vow of silence, or we call it as practicing the silence meditation. Sadhana in itself is samadhi and all that, which Professor Harsha was mentioning, talking about the sadhana, the dharam, and samadhi. Then speaking about all this, like on the occasion of Yoga Day. Hello, can you hear me?
Yes, ma'am.
Okay, sorry. So yes, so Maun Sadhana, I will start off like how it can benefit people, especially with the COVID times, like when people are going through a lot of like stress and anxiety sitting at home. Some people are even isolated and lonely. There is no one to share their grief with, or like whatever they are going through in the life. And then there is this magical Maun therapy, I call it, as assisting and helping us to concentrate towards our inner self. So Maun Sadhana is basically a celebration in itself for the divine in the solitude of life and solitude of the self. So Maun Sadhana, I personally feel, is the language of the infinity and of the void that envelops it all. It not only deepens the self-understanding, like by opening and sharing the sensory gates and shutting the sensory gates, steering it from the outside. The one who speaks without speaking through the inner self. And we really want to focus on the silence and the Maun to have the inner peace and say the things without speaking or talking through the inner self. So we follow certain steps because to follow the Maun practice or the sadhana, Maun sadhana, we call it, because the silence speaks louder than the words. There is a lot of noise and there is a lot of happenings happening around the world. So the silence, it's not like shutting yourself like a piece of wood or a log piece. It's more like the Vak Maun. So the first step to the Maun sadhana, we begin off is with the Vak Maun. Vak is speech and the silence of the speech, which means our thoughts that we bring in or we put forward, they have to be truthful and pure and not hurting someone. So it doesn't mean that we stop talking and we don't communicate. It's not like shutting yourself down, because Vak is using our muscular organ, the tongue, to say the nicer words and be positive, and that's something that can nurture somebody. So when we talk about the first step, the Vak, the silence of speech, we say human energy is often wasted in useless talk. And the tongue sometimes does more harm than a bullet. And the silence, it's not escapism, but a conscious self-restraint that saves one from speaking unpleasant truths or the wrangling or unwanted controversies. So, yet silence of the sewn up lips, it doesn't mean that you sew up your lips. It's not still a silence, because whether you force it or it's voluntary, due to the exigency of the circumstances, it still can't be called as a silence. Even if the human tongue, the movable muscular organ on the floor of our mouth, is chopped off and not stop a bit, in the world of the mortals, because when the chattering of the mind does not stop a bit, it basically is not the silence. So it's not about like shutting your mouth, and sewing up the lips is considered a silence. It's the mind has to stop clattering. So when in the world of mortals, the intelligent speak, which is absolutely necessary, measuring every word in the process, excessive talking dissipates prana. the life force unbalances the mind and leaves very little scope for the higher self to commune with the instinctive intellectual self. So it's a quote that I created, and I feel that we need to talk everything, whatever we say, the words we use, that has to be the balance. And prana is a life force. And the mind, until that stops thinking the unnecessary thoughts, it means it's not a silence. Then the next step is the Chittaman, which is the silence of the mind. So out of the couple steps that I mentioned, the first step is the silence of the speech, which means using mindful words by using your thought process, by not bringing in the past or the future in between. So with all this next step, the Chitman, the silence of the mind, it has having threefold ramifications, which is Buddhiman, the silence of the intellect. Then there is Ahankar Mon, which is the silence of the egoist. Ichamon, the silence of desire. And Indriyamon, which is the silence of the senses. The Indriyamon is followed by the Ichamon when we don't have and we achieve the silence of the intellect, egoist and desire, जिसे हम बुद्धि, अहंकार और इच्छा कहते हैं. उसके बाद हमारा इंद्रिय मौन आता है. तो इंद्रियों का that is basically our senses. So mauन is not the state of negation, but of the awareness, as it gives respite from the activities that are detrimental to the spiritual growth. So this is followed by the Indriya Maun, which is the silence of the senses, which is possible if one can withdraw each sense from its distancing objects. Finally, silence is stabilized within by observing the flow of thoughts when they arise, swell, dilute, or subside naturally in an unending process, and then taking a quantum jump into the pure void of higher consciousness. And which means the higher consciousness is basically transcending into your inner self, which we can call it as a transcendental meditation, because you are taking that jump into conversion of your thoughts to get and achieve the pure consciousness and the higher consciousness. So meditation, how does meditation help with that? Meditation helps one to be inwardly silent in all the three states of consciousness, which is our consciousness stages are wakefulness, dream, and the sleep. जब हम जाग रहे हैं, when we are awake, जागरूकता. When we are dreaming while sleeping, that's kind of like a subconscious state. Then sushupti, nidra, deep sleep. So these are the states of consciousness that we achieve during the meditation to help us to be inwardly silent. And what do we achieve? Not by being silent on the necessary things where you need to speak. You take the silence, as I mentioned before, silence of speech. So to say everything or open your lips, which you don't have to sew or sew your lips, you basically open up the lips either to eat, not for the useless talk, and talking all the useful stuff. So when we talk about the fruit of the silence, it's basically all about the wisdom that we receive through the intuitive flashes and the whispers from the divine are heard when the mind is quiet and composed. In course of time, the silence basically penetrates through each pore of the body and reflects in one demeanor and deeds. And silence, basically, with its purifying power, it helps to check human vices, जिसे हम क्रोध, लोभ, मोह, माया, काम, मोक्ष सब कहते हैं, like anger, moha, infatuation, calm and passion, making way to a spiritual progress. So then, how do we practice maun and silence? It's very difficult in this worldly, material world to shut your mind and your thoughts and stop yourself from not thinking because of what we have in the surroundings, and we are surrounded by all these worldly noises. So it has to be practiced. The Mauan Vrat, especially in this month, so I feel privileged to be talking about this in this season, in the 6th month of the year, June. We generally consider that this month, if we can do a Mauan Vrat, the fasting of the Mauan, for 16 days during this month, that helps us to build our practice towards achieving the silence and the higher consciousness. So Mauan sadhana has to be practiced and should be a daily habit and a routine for achieving like inner harmony. And it should be undertaken for at least 20 to 30 minutes. Best time is early morning, fasting. But if you have to do it in the evening, then it has to be before dinner. At the bedtime, we can practice meditation, but the silence, the Mauan Vrat, has to be either early morning, which is in the Brahma Muhurta, which is early morning, 3:20 till 3:40 a.m. and before the dinner around 5:30, 6 o'clock, in between that time. So we can practice Mauan, and the energy of speech can be transmuted to the spiritual energy. So simultaneously, one should fill the mind with the holy thoughts and meditate on the Supreme Self. So during vacations or the weekend, Maun can be practiced for the whole day or a few hours, depending on one's capacity, so that we can convert the energy of speech and transmute it to the spiritual energy. So the purpose of observing, we call it as Mauni Amavasya, occurring every month on the last day of the dark fortnight, is to do self-introspection by remaining silent. While practicing Maun, one should not eat or drink, brood over the past or the future, communicate by gestures or by writing, watch television, use electronic gadgets, or do something which distracts the attention. One may observe complete silence or restrain speech while taking a morning or evening walk, waiting for a bus or a train during travel, or while performing the course of life. Instead of always looking for a company, one should occasionally stay alone and feel the ecstasy of the inner silence. So those who undertake Maun Vrat, the vow of the silence, for months or years, as in case, you can certainly feel the ecstasy of the inner silence, although it's not possible for an ordinary person to observe, especially the Kashta Maun, which is, as I mentioned before, remaining silent like a log of wood. So one should at least train one's mind in Samyak Vak, which is the right speech, as in Ashtamarg, the eightfold path that's been mentioned even by Mahavir or the Gautam Buddha. So why there is so much emphasis on the silence? So the silence, basically, we all know that the speech is silveren and the silence is gold. It not only helps us to conserve the energy, but to concentrate, introspect our inner self. It helps one in the search of divinity. By observing silence, one gains goals easily. And the most important thing that I would like to mention is about the quiet spirituality. How can silence heal the harried soul? विचलित मन जिसे हम कहते हैं, हमारी आत्मिक शांति कहाँ से आती है? Where does the inner peace come from when there is so much anxiousness and so much noise outside? How can a person be trying to be quiet in the inner self? A lot of my clients used to mention this, that they struggle to actually meditate and be quiet. That's a big challenge. So how you do that is by practicing the wise speech first. So that's the first step that I mentioned. So how the silence heals the soul? It's by practicing the wise speech. And that's called silence. Like the rain necessary for the flowers to bloom, silence is essential for speaking with clarity. And I find myself like silence very healing, not only on the spiritual level, but also physically and mentally. Some people love to go to the spas to relax and get pampered with all kinds of water. They take massage treatments like or do the Panchakarma, Shirodhara, which is a passive meditation. I myself love to go on a retreat and pamper myself with silence, without any voicemails, no emails, no conversation, no radios, no videos. And the silence, it actually refreshes me like a cool shower on a sultry summer day. So in the restfulness of it, I recollect and unify all the scattered pieces of myself. And as a tonic, silence clears away all the exhaustion accumulated from the non-stop noise of the modern urban living and restores my energy. But that, what is a tonic for me? It may not be necessarily a good medicine for someone else. So the meditation teachers and yoga teachers, they may acknowledge that silence may not be the best spiritual practice for the individuals who are inclined towards melancholy or depression or anxiety. They may need to open up and express themselves. Also, it is important not to maintain silence in the face of injustice, which we call it as an ethics in the new millennium. So I will finish for today's by creating this space for all of us, a space of silence, and to grow the inner peace, get into meditation, pranayama, as mentioned by Professor Harsha, and also practicing and having the practice discipline of doing it in the morning from 3:20 to 3:40, and learning the art of letting go. Because if you will try to control even the thoughts, you wouldn't be able to achieve the inner peace. So it's the state of mind that we have to achieve. Even Dalai Lama says that if we keep silent out of the sense of self-centeredness, when it's a problem, we have a universal responsibility to break out of such silence and be the service to others and the mankind. So thank you very much, everyone, for being silent and practicing silence right from now on this auspicious day, International Yoga Day. And thank you for letting me put my insight on practicing more and benefit and reap the fruit of silence. Thank you, Dr. Sheetal, and thank you, Dr. Naveen Joshi and Ayush Darpan, and the platform and the organizers for giving me opportunity to share. Thanks.
Thank you.
Namaste.
Thank you so much, Dr. Vanita, for the wonderful talk on silence, in your insights on silence. Your talk was really nice. It made us spellbound. It really made us to introspect ourselves. And I think everybody feels the need of getting in some inner space to have mauna, to practice mauna in daily world, daily life, because everybody is facing the problems, whatever you have shared in your talk. And today's world, not only the COVID era, but overall the practices of day-to-day practices, whatever challenges we are facing in our practices, in our lifestyle, in our workplace, in our tussles of, in our struggles, daily struggles, whatever challenges we are facing, this is one of the nicest solutions you have given here through meditation and yoga. The practice of silence, the time you have indicated for practicing silence, the do's and don'ts in practicing mauna, everything you have elaborated so nicely. Content wise, it was so good, so simple to understand. And even though it is simple to understand, it is very, very hard to practice. It is hard to learn, I know. But then you have made us introspect ourselves, and you let us, you have just, I can say, you have inspired us to look into ourselves, and the need you have highlighted to travel into one's inner space and practice mauna. So maunam sarvartha sadhanam, as they say. So you have highlighted it so well, and silence speaks larger than words, you have highlighted. And your slides were also so soothing. And at the end, you have shown Julia Roberts practicing silence. So that is the need of the silence. Thank you so much, Vanita, for such a wonderful presentation and joining us here. All the way from Australia, you are here with us today. And it's long that I was trying to get you on this platform. Since our Rakta Mokshan webinar, we had met each other last year, and then this is the day that you are here. So I'm so happy.
No, I am very pleased and honored, and namaste to everyone. And I thank you. Like I'm glad everyone could be part of this Maun therapy we did today, like starting on this auspicious day. And I wish and I hope everyone continues to do that. But this is all about like transcending towards your inner self, and practicing meditation is not, it may be challenging initially, but it's not hard. And it just takes a practice, and all you need to do is just start practicing silence of speech first, and to work on your thoughts, like, because your thoughts purify your speech. So if there is a clarity in the mind, and the mind is not cluttered, it's easy for us to work on the silence of the speech. And if the good holy thoughts are coming out of our mouth, even as I wrote the mantra from Bhagavad Gita, it's the contentment and the peace of mind and the inner peace that we get. And we progress towards the spiritual growth. And that actually makes the meditation pretty easy to practice, even if you are not trained in that area. So thank you very much.
So much.
And yeah, like I'm really honored and pleased, and thank you.
Thank you. Equally honored we are to have you here, Vanita. There is a line behind you: yoga plus meditation equal to lifestyle, and that is what is your presentation has highlighted, and it really assigns you to the theme of International Yoga Day, that yoga for well-being. So for mental well-being as well as physical well-being, we have to practice Mauna and yoga. So thank you so much for being here, and I'm very much pleased to have you here. And
Most
please
welcome.
stay with us today throughout our sessions.
Yes, yes, absolutely.
Yeah. So
I
moving
would love
ahead,
to hear everyone.
Thanks. Moving ahead in this session, our fourth speaker for today is Dr. Raviraj Pardeshi. Dr. Raviraj Pardeshi here. Sir, you are
yes,
here?
ma'am.
Yes. Namaste and welcome, sir, once again here on this very forum of our International Web Conference here on yoga therapy, various aspects. And sir, he needs no introduction at all. He is a very well-known name in the field of, say, motivational speakers from Maharashtra. He is a very good name in this. He is professor in Kriya Share, Jupiter Ayurved College, Nagpur. His educational qualifications are quite high. He is MD from Ayurveda Physiology. He is having PG Diploma in Medical Law and Ethics, National Law School, Bangalore. Then he is having PG Diploma in Healthcare Quality Management, TISS, Mumbai. Then he is PhD Vedic Sciences.
Has she lost connection once again? Hello? Hello?
Am I audible, sir?
Yes, yes.
So he's having 6 Sigma Green Belt, ISI Kolkata. So sir needs no introduction at all. Apart from these highest educational qualifications, he is a very good orator. He is a motivational speaker, and he is doing clinical research since long in the field of research and intensive care medicine in Nagpur and central India. So without wasting time, I would like to call upon Dr. Raviraj Pardeshi for his talk on a brief talk he is saying today on practical insights from Panchakosha. So over to you, sir.
Thank you, Shital ma'am, and namaste to all. I hope my screen is visible. Is it?
Yes, sir.
Yes. So the topic which has been allotted to me, or rather which I have chosen, is a Panchakosha. As I started studying the Panchakosha, initially I felt that it is simple, just there are 5 layers of self which have been described by XYZ Upanishad. But I started going deep into this aspect, or practical or rather spiritual aspect of Panchakosha. I realized that it is a very vast, huge, complex and interesting. So let us see how much I can cover in the time period which has been given to me, that is 20 minutes or 25 minutes. As the name suggests, it's a 5-layered kosha, and this concept is described well first in Taittiriya Upanishad. And it is said that these layers, they cover the identity of true nature of ours. These layers, they cover the true nature of an individual, which we call as Jiva, Atman or Brahman. And if we want to know really who we are, then we have to remove or negate these layers one by one. And then only we'll be able to realize our true existence, or what we actually are, or what I actually am. And this has been described in detail by Acharya Vidyaranya, who was a scholar of philosophy in 10th century. And he has said that these Panchakosha are like guha, cave. And if we want to find or search for ourselves, our true self, then we will have to travel deep into this cave. And to name these caves, the shloka reads as Dehad Abhyantara Pranaha Pranad Abhyantaram Manaha Tataha Karta Tato Bhukta Guha Seyam Parampara. So there are 5 layers of a being, and their names are: the outermost layer is Annamaya Kosha, and beneath, second layer is a Pranamaya, third is a Manomaya, fourth is a Vijnanamaya, fifth is Anandamaya, and within all these layers, the Atman is hidden, and we'll have to find it by negating or by traveling through all these koshas gradually. So these koshas, they progress, or rather their progressive resolution of each into a subtler and more pervasive substratum. And as we go deep, they become more and more subtler, and they are not easy to grasp by our senses, because the outer kosha is a gross physical body. As we move ahead, their subtler nature increases gradually, and it becomes hard for simple for senses to understand it in a simple way. At the same time, they are not separate from each other. They are arranged in an unbroken continuous series. And they all represent the same reality, rather they are manifestation of the same reality. And that reality can be called as a Purush. But again, the Purush is something which cannot be seen, and these koshas can be seen by direct observation or through some inference. And if we ask what is the purpose of learning all this? What is the purpose of learning or studying this concept of a Panchakosha? So the purpose lies in asking what is the goal in our life. Is the goal to have a degree or a post-graduation or a PhD in something? Or is a goal in life to be a rich, to be a successful person? No, these are not ultimate goals in life. As in Ayurveda also we have read Dharmartha Kama Mokshanam Arogyam Moolam Uttamam. The ultimate aim of having health is a moksha. And this applies to the aim of life also. We all should strive to attain the practical state of universal, transcendent, and transpersonal existence. And this should be our ultimate goal. And if we want to reach to this goal, we should understand what these Panchakoshas are. The Brahman is referred as a Sat Chit Ananda. So this term has three words in it. One is a Sat, which is a truth, absolute being. The second is a Chit, which is a consciousness, which is a true consciousness, which really is responsible for understanding the world we are living in. And the third word in this term is Ananda, which stands for bliss, happiness, joy, delightment, or pleasure. So ultimate aim of studying this Panchakosha or yoga for that matter is to attain the state of this Satchidananda, and this state is lasting forever. It is rock stable, though it is a tranquil, and there lies a ultimate happiness for which we should strive for each and every moment. But so as to achieve this, we have to have the knowledge of what Brahman is. And we must first understand that this only is the highest form of knowledge. No knowledge than the knowledge of Brahman is superior. As of now, we are living in a world of spiritual ignorance, and our aim should be to travel from the world of the spiritual ignorance to a spiritual knowledge, because this is the highest state of knowledge. Another question one may ask, why only human beings are considered to give this knowledge, or only humans are invited to accept this knowledge? The Shruti then answers for this is that the man only, or the human being only, is qualified for receiving the knowledge pertaining to this, because he has certain attributes in the form of karma and jnana. Means he only can act in order to receive that knowledge in a perfect manner and practice that knowledge in a perfect manner. And because he only or he alone is competent to follow the teaching, because he only is capable of seeking the aims with which they are intended to secure. So that's why man only is considered as eligible for imparting this knowledge or for receiving this knowledge. Now we will gradually move into the koshas one by one. Sarvam dravyam pancha bhautikam asmin arte. This is a quotation from Ayurvedic classics. And we all know that everything in the world which we perceive or which we live into is a pancha bhautik. But at the same time, even when we know that everything is a pancha bhautik, but we don't own it. And that all pancha bhautik or pancha bhautikatva is owned by nature. And nature always tries to keep a fine balance of these Panchabhutas. And we also want to maintain a healthy state of our being, then we also have to ensure that the state of these bhutas is balanced, that they are not infected or gets affected by any kinds of toxin which will create some kind of imbalance in it, and that is not good for our health. And these panchabhautik padarthas, or whatever we consume or whatever we live into, that is responsible for creating our body. And that's why it is said that sa va esha purusho anna rasamaya. So this gross body which we see, which we feel, is annamaya kosha, and it is a full of anna rasa. This maya stands here as a vikar. So whatever we consume, a product of that is our body. But it is not Atman. But this body is important because it will help us to travel or help us to transport by the ship of a Brahma Vidya to the farthest shore of the great ocean of evil producing koshas. These koshas here are labeled as evil producing, means they have a tendency or capacity to damage or to affect our conscience, and to allow us to remain engaged in a state of ignorance which we don't want. But still we will have to value our body because it is a vehicle which will help us to travel to the state of that highest knowledge. Another concept which is related to this Annamaya Kosha is a concept of a Viraj. Pinda and Brahmand, this concept is well familiar to all Ayurvedic scholars. But in Upanishad, the word for Brahmand is a Viraj. As there is a Purush and Sharir, then the question comes, if the Brahma represents Para Brahma, then Sharir is represented by what? What is representing the Sharir? Then it is said that this whole universe is a Sharir for a Paramatma or ultimate Brahman, and which is labeled as a Viraj. So this Pinda is similar to Viraj, or Pinda is a representation of a Viraj. And this Annamaya Kosh is formed by a vikar of a food. Whatever we consume, whether it is a good or bad, whether it is a toxic or non-toxic, ultimately that sort of sharir or that sort of a kosh will be produced. And not only anna, but the product which we have received from our parents in the form of information which has been transported or transferred through genes, that also contributes in the formation or designing of our Annamaya Kosha. So if you want to stay healthy, we should see that this Annamaya Kosha is taken care of in a good way. We should see that we adhere to all the rules which have been given as far as Rutucharya, Dincharya, all are possible. And if you see that this gross body is given utmost importance by a modern medicine researcher or in a modern medicine, almost all the research which is happening in the area of modern medicine is focused on this Annamaya Kosha. The modern researcher or allopaths, they are targeting on the diseases which are there seen in this gross body: hypertension, ischemic heart disease, obesity, osteoporosis, etc., etc. But this should not be the way. This should not be the only way, rather. Because if we see the Vedic aspect of this kosha, and as we have said that we will have to negate every kosha if we want to reach to the ultimate Brahman, then we will have to consider a few things, that is this body permanent? And the answer will be no, because it keeps on changing. It was, we were a kid when we were 5 years, 10 years old. Now we are 30, 40 years old, so we are young, and in future will be becoming old and older. So that body keeps on changing. So I have done everything fair in my life. I have not harmed anyone so far, but still I'm suffering. And the reason for this is that my Atma is carrying some sanskara from previous birth. I might have committed sins in previous birth, and in this birth, I am made to suffer because of my deeds in previous birth. In Upanishad, this term is called as akrutabhagam. If I do something wrong in this birth, and if I am not allowed, or if I don't get chance to compensate the activity because of that wrongdoing, then that activity will be carried as a sanskar in my soul, and I'll be made to suffer in my next birth. So this is krita vinasha. So these are the two aspect or two phenomena which makes us feel that this body is not ours, as this is changing, and Purusha or Atman is persistent, it does not change. So we are not Annamaya Kosha. And this kind of a thinking or this kind of a knowledge is called as Annamaya Kosha Vivek. Means we are discriminating by thinking that we are not this body. Then we will move into the next layer, which is a Pranamaya Kosha. And this is an energy layer, which is subtle. We cannot see it, but we can definitely feel it. All the activities like pumping of the heart, breathing in and breathing out, moving of a blood within blood vessels, flow of hormones in the body, sensory and motor activity of a nervous system, all these are governed by Pranamaya Kosha, and this is situated between Annamaya Kosha and Vijnanamaya Kosha. So in fact, this is very large, and this contributes to the life force or the energy force of our body, and it is responsible for sustaining our life. As we know that our life starts from the inhalation. First breath is responsible for bringing the life on this earth, and the last breath, exhalation, will make us die. Means that will be the end of life. And this concept has been beautifully explained by Sharangdar in his Sharangdar Samhita. What he tells, that nabhista prana pavanaha, the pranavayu situated in the nabhi, abdomen, or at the level of diaphragm, comes out after touching the heart, spruštva hrita kamalantaram, and it goes out through trachea, kanthad bahir viniryati. For what? Patum Vishnu padamrutam, to drink Vishnu pad amrutam. This atmospheric air or this universe is considered as a feet of a Vishnu, and this Vayu goes out in order to get re-energized. So it has to touch the feet of a Vishnu. Once it touches the feet of a Vishnu, then it becomes energized. It regains power, that vital force again, and its form changes. Pitva cha ambara piyusha. After drinking that ambara piyusha, its speed increases and it comes forcefully. It travels back into the lung. Punaha ayati vegata. And what is the purpose of this activity? A purpose is prinayan deham akhilam jivam cha jataranalaram. To sustain the metabolic activity, to keep the fire in a state of ignition, or to keep that fire ignited, this process of respiration goes on, and this is activity which happens under the control of a pran in the area which is called as the pranamaya kosha. So we all know that there are pancha prana, pranamaya, udan, samana, pan, and these pancha prana, they combinedly or collectivity performs all the activity of a human body. But again, the question comes that whether this pran is limited to that body, or does it goes out of body, does it travel out of body and influences our surrounding. So we all must have experienced that after going to temple or visiting some temple, will feel fresh, and we feel that there is some aura or energy which is circulating there, and once we go into that area, we also feels energized. Another example, if some child while playing falls down, and if his mother goes to him and takes him close to chest, that uh, child stops crying. So that child is not given any painkiller, but the moment his mother holds him to her chest, he stops crying. So there is a release of endorphins, which is a response of that holding. That mother has held her child with utmost love, affinity, which has resulted into a release of some kind of a chemical hormones in the body of a child. So this is ultimately a pran or energy which has traveled from the body of a mother to the body of a child. So this means that this pranamaya kosh has existence beyond body also. But is this pran the synonym for I or Purush? No, because this pran keeps on changing. Sometimes we are energetic, sometimes we are tired, sometimes we are sick, sometimes we feel that we should have food, sometimes we feel that we need not have food. So this state of level of energy keeps on changing, and this is not a characteristic of Purush. This is not a characteristic of Atman. So again, Shruti and Upanishad says that no, we are not a pranamaya kosh. So let us travel more deep. The third layer of existence is a manomaya kosh, which is a mental body, psychological level of existence. And this takes us to see the outer world and helps us collecting the information using our senses. So whatever influx of thought we get, or whatever we perceive from our surrounding world or outer world, whatever thoughts we receive, be it a positive or a negative, all this is happening in a layer which is called as a manomaya kosh. So this manomaya kosh is continuously engaged in collecting the data. But Shruti says that this data collection must be with some purpose. Some purpose. It should not be purposeful. It must be purposeless. And whatever we receive or whatever thoughts we allow to travel into our mind, they must be checked. And only those who are those thoughts which are good must be allowed to flow in. But this manomaya kosha is in close proximity with the body. All the happenings, all the changes in the manomaya kosha affects the activity of other two koshas, pranamaya kosha and annamaya kosha both. Because we all experience whenever the emotions become powerful and whenever they start governing our actions, our body or sharir or manomaya kosha and pranamaya kosha will get affected. Like if we become angry, our heart rate will increase. There will be vasoconstriction, our blood pressure will rise. The pumping of a blood from heart will increase. And if this is sustained, then this will create some sort of a stress and will invite diseases. So this adi means the imbalances in the manomaya kosh or persistent stress, which is called as adi, will lead to vadhi, which will affect pranamaya and annamaya kosh both. Another aspect of this manomaya kosh is that it is our personality. We judge people not by their appearance, but how they behave, how they think, and how they react to other people. So this manomaya kosh is something which is closely related to the aspect of a personality of a human being, and it has 4 instruments to operate. And with these 4 instruments, this manomaya kosh keeps on handling the things, and they are manas, buddhi, ahankar, and chitta. Again, we will be saying that, okay, If this Manomay Kosh is so important, then we are a Manomay Kosh, or I am a Manomay Kosha. But again, Upanishad says, no, this is not the case. Because we, or I am aware of the mind. So mind and I both are different. State of my mind or mentality keeps on changing. Sometimes I'm happy, sometimes I'm not happy. I may have desires sometimes I may not have any desire. With me, even if my prana and annamaya kosha are doing well, but still because of some desires or because of some expectations, if they are not met, then I'll be unhappy. So all is well, all is not well. So these states are changing, and this is not a case with Atma, because Atma doesn't change. It is ever changeless. It is not affected by anything, while Manas is affected by a variety of things. So I am not Manomaya Kosha. So Shruti or Upanishad again says, let us go deeper. Let us find if something else is there, and then we go into the fourth layer of our existence, which is a Vijnanamaya Kosh. And this is a sheath of intellect or intellectual level of existence. And here we have a place for having Vishesha Jnana, which we can call as a cognition or wisdom. And this Vijnanamaya Kosh is responsible for witnessing everything. And it keeps on watching us every time. And this is a sort of intuition. Intuition means there is some sort of feeling with which we decide or take decisions in life, or pursue some things which may not have rational basis. And most of the time this is based on the experiences we have had in life so far. So this intuition is also a characteristic of a Vijnanamaya Kosh. So doing things is a job of a Manomaya Kosh, and the awareness of that doing, how it is being done, whether we should do it or not, what would have happened if I would not have done it. This kind of a decisiveness or discrimination is a characteristic feature of this Vijnanamaya Kosh. Conditioning or deconditioning of intellect is also a feature of a Vijnanamaya Kosh. So it is said that this Manomaya Kosh and Vijnanamaya Kosh are two sides of one coin. When we look outside, then it's activity of a Manomaya Kosh. But if the same activity is done by looking inside within, then it is said that we are into a Vijnanamaya Kosh. And here comes the role of Pradnya Paradi in Ayurveda, Di, Dhriti and Smriti Vibhransha. So it is all derangement in a Vijnanamaya Kosh which leads us to commit a crime or to commit a mistake, which we call it as a Pradnya Parad, and which is a cause of a disease. So is Vijnanamaya Kosh close to Atman, or are we Vijnanamaya Kosh? Again, Shruti says no. Because Vijnanamaya Kosh, or the activities which are there in the Vijnanamaya Kosh, keeps on changing. They are different when we are in sleep. They are different when we are awake. So in Sushupti and in Jagrat Avastha, they keep on changing, which is not a characteristic feature of Atman or a self. So this also is not a self. So it is something different. Then journey continues, and we enter into the fifth or final layer of our being, which is called as Anandamaya Kosh. This is a sheath of a sheath of a bliss, which is a playful, fearless. And when it is in align with rest of the koshas, then only it can be experienced. Because this Ananda is called as a supreme bliss, eternal, far other and higher in its character than the highest human joy or pleasure, is the essential and original nature of the spirit. This reflects the original nature of a spirit, and this can be experienced only when we are in deep sleep, not in a state of dream. because in sleep we forget the world around us, but still after getting awake or after awakening, we can experience that we have had a certain good experience. बोलते समय हम लोग बोलते थे कि बहुत अच्छी नींद लगी, मैं घोड़े बेच के सोया था. When you were not aware of anything going around in your outside world, how did you know that you have had a good experience? That means there was some sense of a joy which you remember even after getting out of sleep. This means that that particular state you were into this kosha, which is called as a Anandamaya kosha. So this is the most subtle aspect of our experience because it is devoid of any form of emotions. There are no good emotions, no bad emotions, no painful emotions, no pleasure or pleasurable emotions. And this is a state of complete silence, complete harmony, because this stage is in align with all other four koshas. But again, the question comes then, are we this Anandamaya kosha? No. Again, the Shruti says that we are not Anandamaya kosha either, because we don't always remain in a state of sleep. After certain time, we awake, and that state of joy vanishes. Again, we come into contact with the worldly affairs, the people around us, the things around us, which may not be that enjoyable always. So this state of mind or this state of our self is changing. So this is not we, this is not I. Ultimately, the Panchakosha theory or Upanishad indicate that all these five sheets will have to be negated if we want to experience the real status or real nature of ourself. So by negating these sheets only we can attain that higher state of knowledge or higher state of existence. But from physiological point of view, from clinical point of view, or from yogic perspective, we will have to give utmost importance to each and every sheath or each and every kosh, and we'll have to decide what sort of measures, therapeutic measures or diagnostic measures can be applied for each and every kosha which have been described in Taittiriya Upanishad. With this, I'll end my talk here. Om Asatoma Sadgamaya Tamasoma Jyotirgamaya Mrityorma Amrutam Gamaya. I thank Ayush Darpan, Sheetal ma'am, for providing me a platform and for giving me opportunity to share my views. And Dr. Vanita Sharma is there?
Yes, she is there.
Yes, yes. So, ma'am, I'd like to get in touch with you and would like to get more information, as I guess that you can give me some input as you have studied much of the yogic science or the science of Mauna, which we had gone through just before my lecture there.
Thank you, Dr. Raviraj sir. I would convey your thoughts to Dr. Vanita, even if she is right now, she is in the meeting, but maybe she's somewhere else. So thank you so much for your wonderful talk on your practical insights on Panchakosha. Actually, we had some idea about Panchakosha, but it was really very, very superficial, I guess. And today we have given a ride to us through the Panchakosha, your practical insights and their correlations to genetic inheritance, the law of karma, the Vijnanamaya Kosha and its correlation to our psyche, then Anandamaya Kosha, its correlation to emotions and other aspects, and sir, very well elaborated lecture by yours, but it is just a brief sensitization to the advanced level insights of yours on this Panchakosha Vidyan, you can say, or one can say. So we would like to have the details of these things in certain further
Yes,
sessions
so
we can arrange.
one
So
kosha will require 2-3 hours then. Each kosha, yes.
definitely I can understand. It is that much detailing of things it is required for such a wise presentation what you have done today. But still we would like to have you somewhere someday on some international platforms like this or other platforms even. So thank you so much for being here and giving your practical insights on Panchakosha. And please stay with us. We are having 2 more
Yes,
international
yes,
speakers today.
yes.
So
I'm there from beginning and will stay till end.
yes,
I
I know,
will
sir.
travel. I will travel through all levels of kosha here also.
Yes, yes, that is the that are the real signs of a researcher, and the deep knowledge, the thirst of deep knowledge the researchers have. So we are sailing in the same boat, sir. Thank you so much. And
Thank you. Thanks a lot.
we are happy to have such wonderful speakers today with us. So moving ahead, sir, and moving ahead, all of our guests and researchers and academicians, delegates, I would like to brief you. We are selling in the guest lectures series, and we are having with us today 4 lectures we have completed, and we have 2 more lectures to go today. So welcome again to all on this very pious platform of International Web Conference on Yoga Therapy, various aspects. We are doing this venture in collaboration of Datta Meghe Ayurvedic Medical College, Nagpur, and Ayush Darpan. And we are here to celebrate the 7th International Yoga Day celebrations going on in Datta Meghe Ayurvedic College and also on Ayush Darpan. So let us welcome our 5th guest for today, Dr. Jaya Jane, madam. Welcome Dr. Jaya Jane, madam, on this very platform. I guess she is here. Madam is here since the beginning.
Yes, I'm here.
Yes, Jaya madam, welcome here again. Once again, I welcome you here. And Jaya madam also needs no introduction. She is a very well-known name of Sanskrit Sahita Siddhanta. She is a professor head at KVTR's Ayurveda College at Boradi, Dhule. And she is a dynamic academician. Since I know her since her beginning days, we were sharing the same platform of I must say here that we were sharing the same platform of MS Ayurveda College Gondia, and since then I know her. She's a very good academician. She is very much free for students always, and she is available to all of the students as well as academicians for their queries and their festival knowledge. And she is teaching Padartha Vidyan and Ashtanga Sangraha in such a way that students ask her many questions on clinical side of the subject. So welcome them here. These are the other things which I must share here. But then she has got a very good academic index even. Madam is has done her graduation and post-graduation in Sahita from Government Ayurveda College, Nagpur. She is MA in Yoga Shastra. She is having diploma in Yoga Shiksha, which is government recognized, and professor and head at Department of Sanskrit Sahita at KVTR's Ayurveda College, Boradi, Dhule, Maharashtra. 22 years of teaching experience. She is member of College Ethics Committee. She is coordinator for 2 research trials at her institute, then member of expert panel, Journal of Sanskrit Sahita Siddhanta. Then she has got many publications on research on meditation and insomnia and yoga and stress management. Then she has delivered many invited talks on yoga, paper presentations on yoga in national and international levels, seminars and conferences. She has authored one book on Dinacharya and Rutucharya, and she is active in cultural and extracurricular activities along with the academic activities which are going on. So this is just a brief introduction of Madam, but she has got multiple aspects to her personality, and she is very active in academics as well as the clinical side. So welcome Dr. Jaya Madam here on this very platform, and I welcome you with your topic for today's presentation, that is the importance of yoga therapy in present contemporary world. So importance of yoga and pranayama in the contemporary world. So welcome ma'am.
Screen share होता है.
Hello, am I audible?
Yes madam.
स्क्रीन शेयरिंग नहीं हो रहा है.
अच्छा, just a minute.
हे होता है काय म्हणतात त्याला, नेटवर्क थोडंसं स्लो आहे. याच्या मागे आहे आपलं. हे आहे हे. एक मिनिट इथे थांबा. Just a minute. Am I audible, Sheetal?
Yeah, and your screen is visible, ma'am. Now screen is also.
Sri Dhanvantare Namaha. Good afternoon, everyone. Thanks, Dr. Sheetal, for introducing me. I thanks organizing committee for giving me this wonderful opportunity. International webinar, which is organized by Datta Meghe Ayurvedic Medical College and Hospital and Research Center, Nagpur, in collaboration with Ayush Darpan Foundation, Dehradun. Thanks, Dr. Naveen Joshi, sir. हर देश में तू, हर भेष में तू, तेरे नाम अनेक तू एक ही है. हमारी प्राचीन परंपरा और भारत की धरोहर का स्मरण करते हुए आज के इस युग के हम अंतरराष्ट्रीय दिवस, आज के इस युग में हम योगा डे मना रहे हैं. उसकी सभी को मैं आपको हार्दिक शुभकामनाएं देती हूँ. और आज का मेरा सब्जेक्ट है इम्पोर्टेंस ऑफ योगा इन द कंटेम्पररी वर्ल्ड. एक्चुअली इतने सारे स्पीकर और अच्छे सब हो गए हैं, तो उसके बाद में मेरा कुछ कहना, तो मैं, हेलो, am I audible?
Yes. Hello, madam, you are audible. Please continue.
Okay. Ayurveda life knowledge. Ayurveda, the great system of medicine in India, is a complete health science, and for that, the Ayurvedic procedure Dinacharya, Ratricharya, and Ritucharya is important. We all know these things. Goal of Ayurveda: Samadoshaha, Samagnischa, Samadhatu, Malakriyaha. You know these things also. Trayopastambha, Ahar, Nidra, and Brahmacharya. In Ayurveda, there is a description of Trayopastambha. All the three are very important factors for health. With all included in Dharaniya way, non-suppression of natural urges. Roga sarvepi jayante vego udirana dharaneha. Ashtanga Vriddhi, 4th chapter, 22. We know these things. And main topic is that what is yoga? What is the evidence that yoga has health benefits? क्योंकि इसमें युग में हम लोग काफी लोगों को सुनते हैं कि भाई मैं योगा कर रहा हूँ, जानते हैं क्या योगा क्या है. हर किसी को, अभी आप बाहर भी घूमने के लिए निकलेंगे या मॉर्निंग वॉक में निकल रहे हैं तो देखेंगे कि रोड पर या रोड के डिवाइडर पर भी लोग योगा करते हुए, प्राणायाम करते हुए हमें दिखते हैं. तो व्हाट इज द एविडेंस दैट योगा हैज हेल्थ बेनिफिट्स? इन आयुर्वेदा देयर इज अ डिस्क्रिप्शन ऑफ वर्ड योग in Charasthana and also in Sutrasthana also. The person, Dr. Sheetal, ने भी बताया है स्टार्टिंग में कि इनकी वजह से भारत में तो भी हर जगह पे किसी को भी पूछते हैं हम कि यदि आप योगा करते हैं क्या, जी हाँ, हम टीवी लगा देते हैं और योगा करते हैं, रामदेव बाबा को फॉलो करते हैं। कृत्स्नो हि लोको बुद्धिमतामाचार्यः शत्रुश्च बुद्धिमताम, चरक विमानस्थान 8th chapter. The entire world is the teacher to the intelligent and the foe to the unintelligent. Yoga system, systematization by Patanjali, ये सब हो गया है। योग दर्शन 5000 years old. Yoga means usual means union. It also means discipline or effect. Main topic, yoga chitta vritti nirodha. What is mean by yoga? योग चित्त वृत्ति निरोधः, 4 शब्द इसमें आए हैं। ये योगा की डेफिनेशन है कि योगा किसे कहते हैं। एक्चुअली वर्ड इज अ योग, नॉट योगा। और आज के इसमें हम जब देखते हैं कि योगा करते हैं, आसन कर रहे हैं, प्राणायाम कर रहे हैं, तो उसका मीनिंग ये हो गया कि वो क्रिया कर रहे हैं, वो करने की क्रिया है, जिनकी उन क्रियाओं की वजह से हम योग तक पहुंच पाएंगे। यदि हमें योग साध्य करना है तो हमें योग चित्त निरोधः का मीनिंग समझना पड़ेगा कि उसका अर्थ क्या है। तो योग का मतलब है अष्टांग योग, उसमें दिए हैं 8 जो फोल्ड्स हैं। चित्त, मूढ़, क्षिप्त, विक्षिप्त, एकाग्र, निरुद्ध, वृत्ति, प्रमाण, विपर्य, विकल्प, निद्रा और स्मृति। योग चित्त वृत्ति निरोध का मतलब है, योग का मतलब है चित्त के वृत्तियों का निरोध करना, उन्हें रोकना। जब हम मन में उठने वाले विकारों को रोकेंगे तो ही हमें योग की प्राप्ति होगी। और ये योग की प्राप्ति किससे होगी? ये योग की प्राप्ति हमें, ये जो हम आगे अष्टांग करने वाले हैं, यम, नियम, आसन, प्राणायाम, प्रत्याहार, उनकी वजह से हम इस योग तक पहुंचेंगे। अंतरंग और बहिरंग इस तरह के 2 प्रकार उसमें बताए गए हैं। अष्टांग योग मॉरल कोर्स, अहिंसा, सत्य, अस्तेय, ब्रह्मचर्य, अपरिग्रह, नियम, शौच, संतोष, तपस, स्वाध्याय, ईश्वर प्रणिधान, आसना। अभी बहुत सारे नीरू मैडम ने और हर्ष मैडम ने, उन्होंने इन सब के बारे में बताया है। प्राणायाम, कंट्रोल ऑफ ब्रेथ, प्रत्याहार, धारणा, ध्यान एंड समाधि। योगा मीन्स यूनियन ऑफ बॉडी, माइंड एंड सोल। हम जब भी बात करते हैं करते हैं कि इस आसन से ऐसे होता है, इससे मधुमेह हमें लाभ है, इससे स्पॉन्डिलिसिस पर है, मेंस्ट्रुअल प्रॉब्लम में इस पे लाभ है, मेनोपॉजल में ये करना है, गर्भिणी को ये आसन देना है। इस तरह से हम सोचते हैं। बॉडी मीन्स एनाटॉमिकल एंड स्पिरिचुअल, इन दोनों पर योग का असर होता है। योगा इज मैजिक की to live a life full, experience the magic of yoga yourself own। जब भी हम योगा की बात करते हैं तब यदि कोई में बता रहा है कि भाई योगा करने से ऐसे ऐसे होता है, ये लाभ हमें प्राप्त होते हैं, लेकिन हमने उसका अनुभव किया है क्या? जब हम खुद उसका मैजिक अनुभव करेंगे तो ही हमें ये पता चलेगा कि योगा के क्या बेनिफिट्स है और योगा से कैसे फीलिंग आता है। योगे मोक्षे च सर्वसां वेदना नाम वर्तनम, मोक्षे निवृत्तिर निर्शेषा, योगो मोक्ष प्रवर्तकः, चरक शारीर स्थान में कहा है। और प्रथम जो प्रार्थना कही गई थी, जोशी सर ने कही थी, योगेन चित्तस्य पदेन वाचा मलम शरीरस्य च वैद्यकेन। योगेन चित्तस्य, चित्त को यदि शुद्ध करना है तो हमें योग को अपनाना पड़ेगा। पदेन वाचा व्याकरण भाषा के लिए है और वैद्य को मल का निर्हरण शरीर से करने के लिए कहा है। मतलब योगेन चित्तस्य, चित्त के लिए हमें योग अपनाना चाहिए और तभी हम उस पर नियंत्रण कर सकते हैं। डाइट इन योगा, सात्विक फूड बहुत जरूरी बात है। ये नीरू मैडम के इसमें भी आया था, उनके प्रेजेंटेशन में ये आए थे। हेल्दी फूड तो ही हेल्दी लाइफ रहेगा। कहा गया है कि नास्ति क्षुधा समम दुखम, नास्त्याहारम समम सौख्यम, क्योंकि भूख के जैसा कोई दुख नहीं है और भोजन के समान कोई सुख नहीं है, लेकिन उस सुख का अनुभव लेते हुए भी हमें सात्विक फूड लेना चाहिए, ये वहां पर कहा गया है। जब भी इस पेंडेमिक की अवस्था में हम देख रहे हैं कि हर कोई किसी न किसी उलझन में फंसा हुआ है, बहुत ही अवसादपूर्ण अवस्था इस समय हमें दुनिया में दिख रही है, और इससे उभरने के लिए हमें योग और प्राणायाम, प्राणायाम तो उसी का एक अंग है, योग हमें बहुत ही जरूरी है और बेहद कारगर वो साबित होता है और महत्वपूर्ण है। बाहर की दुनिया में देखते हैं तो लड़ाई झगड़ा, हर कहीं एक्सीडेंट, कुछ ना कुछ दिख ही रहा है। स्टूडेंट्स लोगों में चिड़चिड़ापन आ गया है, घर पर बैठे हैं, स्कूल के बच्चे घर पर बैठे हैं, किसी की नौकरियां गई है, किसी के बिजनेस ठप हो गए हैं, कुछ ना कुछ प्रॉब्लम चल रहे हैं। मन में उनके असंख्य भ्रांतियां है कि कल क्या होगा, अनगिनत विचार उठ रहे हैं। तो उसमें समझ में नहीं आ रहा है कि भाई करे क्या, है ना, कि उसमें करना क्या है। तो ये योग जो है, ये योग हमें इसमें से बाहर निकाल सकता है, क्योंकि लोगों का जो धैर्य है वो धैर्य दिन ब दिन कम होते जा रहा है। लोग उसमें ऐसी सिचुएशन में फंस गए कि भाई मैं कहाँ फंस गया हूँ, दिन ब दिन लॉकडाउन बढ़ रहा है, फिर कैसे करेंगे। तो अभी तो लॉकडाउन कम हो गया है, तो इसका मतलब ये नहीं कि हम अपना धैर्य छोड़कर अभी बाकायदा बढ़िया हम लोग घूम रहे हैं, ऐसे भी नहीं। तो इसमें कोरोना वोरोना कुछ नहीं है, ऐसे भी नहीं है, डरना भी नहीं है ज्यादा, और उसमें से उभरना भी है। तो उसके लिए हमें योग बहुत ही लाभकारी सिद्ध होता है, क्योंकि मन में उठने वाले नकारात्मक भाव जो उत्पन्न हो रहे हैं उन्हें पहले हमें जानना चाहिए। उन्हें जब हम जानेंगे तो ही उनमें से हम लोग निकल पाएंगे। क्योंकि योग के बारे में कितना कोई भी बता दे तो भी ये खुद अपने लिए खुद को करने की बात है। जब तक हम खुद नहीं करेंगे तब तक हम नहीं उभर पाएंगे उसमें से, क्योंकि इस स्थिति में से मुझे खुद को ही उभरना पड़ेगा। कोई आके बाहर से ऐसे निकाल नहीं सकता है कि भाई हमको एंजाइटी है, डिप्रेशन है, स्ट्रेस है, आप थोड़ा सा निकाल दीजिए, तो ऐसे नहीं होगा। वो आपको सजेशन देंगे, वो आपको मेडिसिनल इसमें इसे बताएंगे कि भाई आपके ये मेडिसिन है, उसके साथ में आप योग कीजिए। वो करना तो आप ही को है, और इसी की सहायता से हम हमारे जो भी व्याधि है उस पर भी हम काबू पा सकते हैं। क्योंकि आज की दुनिया में क्या हो रहा है कि हर कोई, हम लोग चौपाल पर यदि 4 लोग मिल भी जाए तो कोई ना कोई बंदा मिलता ही है हमें कि जो हमें ये कहे कि भाई मैं योगा करता हूँ, तो वो डायरेक्टली आसन से स्टार्ट करता है। क्योंकि वो टीवी पे भी रामदेव बाबा को देखेगा तो वो डायरेक्टली आसन, प्राणायाम, कपालभाति जो शुद्धि क्रिया है हठयोग प्रदीपिका में जो 6 बताए गए हैं, धोती, बस्ती, नेति, त्राटक, नौली, कपालभाति, ये सारी, तो ये शुद्धि क्रिया है। बहुत बार लोग क्या करते हैं कि कपालभाति टीवी में देखकर ही करना चालू कर देते हैं। एक्चुअली आपको कोई भी क्रिया किसी योग शिक्षक के अंडर ऑब्जर्वेशन में ही करनी चाहिए, कोई भी। क्योंकि किसी ने आसन बताया और कर लिया, इस तरह से नहीं होना चाहिए। क्योंकि क्या जो 2-4 आसन कर लिए हमने और हम योगी हो गए, ऐसे नहीं होगा। क्योंकि जैसे मैंने पहले बताया, योग चित्त वृत्ति निरोधा, चित्त में उठने वाली, उभरने वाली वृत्तियों को रोकना, यानी मन के विकारों को रोकना ही योग है। और ये योग हमें साध्य होगा आसन, प्राणायाम इत्यादि, धारणा, ध्यान, सारे इन जो 8 को जब हम फॉलो करेंगे तभी हमें ये साध्य होगा। प्रसन्न, इसके लिए हमें सबसे पहले, जैसे वनीता मैडम ने भी कहा कि हमें ब्राह्मण मुहूर्त उठना चाहिए, और कोई तो 2 समय हमें फिक्स कर लेना चाहिए कि भाई एक तो सूर्यास्त में या सूर्योदय के समय हम इन क्रियाओं को करें। आसन जब भी करते हैं, कोई भी आसन हो, पर्वतासन हो, भुजंगासन हो, अर्ध मत्स्येंद्रासन हो, कोई भी आसन जब हम करते हैं तो आसन करने की विधि में प्रयत्न शैथिल्य होना चाहिए। ये योग सूत्र में बताया है, पतंजल योग सूत्र में, कि प्रयत्न शैथिल्यम स्थिरम सुखम आसनम। तो स्थिर सुखम आसनम का मतलब क्या हो गया कि जो आसन हमने लिया है उसमें स्थिर रहना है आपको, ऐसे हिल रहे हैं, डुल रहे हैं, इस तरह से नहीं करना है। और प्रयत्न शैथिल्य, मुझे नहीं जम रहा है, डायबिटीज है, मुझे अर्ध मत्स्येंद्रासन बताया गया है, मुझे एडवाइस किया है, मैं बहुत ट्राई कर रहा हूँ, ऐसे नहीं करना है। उसमें हमें ऐसे ही करना है कि भाई धीरे धीरे आने वाली चीज है, वो धीरे धीरे आप उसको साथ में कर पाएंगे। 2-4 दिन में समझने वाली या 2-4 दिन में सीख लेने वाली बात नहीं है। इसलिए प्रयत्न शैथिल्य कहा है, तभी हम इन आसनों का ठीक से उन व्याधियों में, जिन जिन व्याधियों में जो आसन बताए गए हैं, जैसे नीरू मैडम ने भी काफी अच्छे से बताया कि ये आसन, उन्होंने पूरा प्रोटोकॉल, उनका जो भी स्टडी है उस बारे में बताया। तो उस तरह से यदि हम करेंगे तो ही हमें उसके लाभ प्राप्त होंगे। ध्यानात्मक आसन जब भी हम करते हैं, कोई भी ध्यान हमें जब लेना है, तो जिसे हम मेडिटेटिव आसनास कहते हैं, समम काय शिरोग्रीवम कहा है। समम काय शिरोग्रीवम का मतलब क्या हो गया कि शिर, काया और ग्रीव ये सारे एक लेवल में होने चाहिए। और इनमें जब हम मेडिटेटिव आसनास करते हैं प्राणायाम करना है, ध्यान करना है, तो हमें ये मेडिटेटिव आसनास करने पड़ते हैं विदाउट एनी डिस्टर्बेंसेस, हमें वो करना है। इसीलिए समम काय शिरोग्रीवम कहा है। और ये आसन हमें स्टेबिलिटी और ट्रैंक्विलिटी ऑफ माइंड प्रदान करते हैं, जो कि ध्यान के लिए हमें आवश्यक है। मेडिटेटिव आसनास प्रोवाइड actually broad triangular base for the body formed by 2 knees and the pelvis. This broad base gives firm foundation to the body and makes it steady and stable. Even if one loses the body sense during meditation, he remains balanced and due to subconscious control over it. The spine, जैसे मैंने कहा कि वर्टिकल इसमें और स्ट्रेट पोजीशन में होना चाहिए, कि जिसकी वजह से avoids compression of the abdominal organs and keeps the straight position and keeps the body abdominal muscles free for breathing. Digestive organs पर भी उसका परिणाम होता है, इसलिए समम काय शिरोग्रीवम का है। प्राणायाम जब भी हम करते हैं, यानी हमने यम देख लिए, सत्य अहिंसा सब बाद में नियम हो गए। यम नियम आसन ये तीसरे पायदान पर है। यम नियम आसन के पश्चात हम प्राणायाम को फॉलो करेंगे। और प्राणायाम जब हम करते हैं तो प्राणायाम यानी क्या, अभी मैंने जैसे कहा कि हम जब रास्ते पे घूमते हैं तो देखते हैं कि बहुत ऐसे जोर जोर से प्राणायाम कर रहे हैं, तो एक्चुअली प्राणायाम यानी श्वास का नियमन करना है। उसके भी कई प्रकार है। हम सहज सरल रीत्या हम लोग अनुलोम विलोम प्राणायाम कर सकते हैं। चेहरे पर एक शांत संयमित भाव होना चाहिए। इस विषय का ब्यौरा एक्चुअली बहुत बड़ा है और मैंने सब्जेक्ट ही एकदम योग ले लिया, तो उसमें बहुत समय 15-20 मिनट में उसे बताना एक बहुत बड़ी मुश्किल बात है। लेकिन प्रैक्टिकली हमें क्या करना चाहिए कि वो मैं बता रही हूँ कि हमें चेहरे पर शांत और संयमित भाव रखना चाहिए, जो शरीर और मन को स्वास्थ्य प्रदान करे। और जो प्राणायाम हम कर रहे हैं ऐसे पूरे शांति के तरह से, तो फिर हमें उससे सुखानुभव होगा। खुशी महसूस करना, दुख होना, ये मन का स्वभाव है, क्योंकि ये हम ही जानेंगे, है ना, कि हमें सुख हुआ है या दुख हुआ है। और उससे उभरने के लिए हमें योग और प्राणायाम फायदा करते हैं। तो प्राणायाम करने से पहले हमें पहले दीर्घ श्वसन करना चाहिए, संत श्वसन करना चाहिए, जो अनुलोम विलोम कहते हैं, जिसमें कि पूरक और रेचक किए जाते हैं। और इसी में जब हम बंद बांधते हैं, उड्डयन बंद है, जालंधर बंद है, मूल बंद है, तो उसे फिर नाड़ी शोधन प्राणायाम कहा जाता है। उसमें फिर प्राणायाम में भी जब बैठते हैं तो ऐसे बहुत पेट मुड़ा हुआ है, छाती पर दबाव है, ऐसे नहीं होना चाहिए। और इसीलिए समम काय शिरोग्रीवम कहा है। शांत बैठना इसलिए कहा है कि यदि हमारे शरीर की हलचल होती रहती है, यदि मूवमेंट होती रहेगी, तो एनर्जी उधर जाएगी। तो हम लोगों को जो शांति प्राप्त होना चाहिए या एनर्जी थोड़ी कम वेस्ट होना चाहिए, तो वो नहीं होगा। इसीलिए वहां पर शांत रहने के लिए कहा है। प्राणायाम के प्रकारों में भ्रामरी प्राणायाम है, उज्जाई प्राणायाम है, भस्त्रिका है, सूर्यभेदन है, चंद्रभेदन है, शीतली है, सितकारी है, काफी प्राणायाम के प्रकार है। पंचकोश मैंने इसलिए लिया था, एक्चुअली इसके पहले भी स्लाइड्स थी, लेकिन परदेसी सर का मेरे पहले प्रेजेंटेशन था, तो फिर मैंने वो कट कर दिए। तो पंचकोश के इसमें सर ने बहुत ही अच्छी तरह से उसे एक्सप्लेन किया है, क्या क्या करना चाहिए जब हम चिकित्सा कर। पंचकोश के द्वारा भी हम रुग्ण पर व्याधियों, हम लोग भी खुद पर चिकित्सा करना है। तो इस तरह से कोई फैक्ट्री में कोई कर्मचारी हमारे पास आता है कि भाई बहुत स्ट्रेस है, बॉस का बहुत ही मुझ पर लोड है, मैं बहुत ही फ्रस्ट्रेट हो गया हूँ, उस पर भी चिकित्सा करना है, या कोई गर्भिणी पर करना है, कोई मेनोपॉजल स्टेज में करना है, तो हम इसी कोश वाइज यदि जाते हैं तो इस तरह से अन्नमय कोश पर हम आसन शुद्धि क्रिया करेंगे, प्राणायाम कोश पर हम प्राणमय कोश पर हम प्राणायाम करेंगे, मनोमय कोश पर हम ओमकार साधना, ध्यान है, धारणा है, और योग निद्रा, जिसका उल्लेख अभी मैं कर रही हूँ कि योग निद्रा बहुत जरूरी है। बहुत सारे YouTube पर और है वहां पर अवेलेबल कि आपको किस तरह से करना है। योग निद्रा से हम इस पेंडेमिक के भी तनाव से उभर सकते हैं। जिस भी तरह का स्ट्रेस हमें है उससे उभरने के लिए हमें योग निद्रा बहुत ही लाभदायी होती है। इसलिए ओम का साधना, ओम का जो चैंटिंग ऑफ ओम है, तो उसे हमें करना चाहिए, ध्यान चाहिए, धारणा करना चाहिए और योग निद्रा करनी चाहिए। विज्ञानमय कोश में सात्विक आहार, अभी इसमें मैं कहूंगी कि नॉनवेज लेना है, वेजिटेरियन लेना है, जो भी आहार है वो सात्विक लेना है, जिससे किसी भी प्रकार की हिंसा नहीं होती है, यानी शारीरिक और मानसिक हिंसा ना हो, उसे हम सात्विक आहार कहते हैं। वी आर एंटी चेंज इन लाइफस्टाइल, ये हम काफी लोगों को एडवाइस करते हैं, लेकिन जब हमें जीवन क्या है यही नहीं पता तो हम उसका स्टाइल कैसे करें, है ना। मैं पहले इसलिए मैंने वो स्टार्टिंग में स्लाइड्स डाले थे कि दिनचर्या, ऋतुचर्या, इनका सबका, इन सभी चीजों को जब हम करते हैं तब हमारे जीवन में कुछ तो आनंदमय ये रहेगा, हम में नहीं जाएंगे, स्वस्थ अवस्था में रहेंगे। और यदि लाइफ क्या है, जीवन क्या है, ये हमें पता रहेगा तो ही उसका स्टाइल हम चेंज करेंगे। यदि जीवन क्या है पता नहीं तो उसका स्टाइल हम चेंज नहीं कर पाएंगे, क्योंकि नहीं तो फिर हम बाहर से पिज्जा मंगा रहे हैं, सब कर रहे हैं, तो इसमें कुछ मतलब नहीं रहेगा। आनंदमय कोश, उसमें मंत्र जप और प्रार्थना कही है, ध्यान और प्रार्थना दोनों बातें इसमें आई है। इन बोथ द केसेस, यानी मेडिटेशन एंड प्रेयर, we contact ourselves to God, but the difference in both cases is in prayer he listened to us, but in meditation we listen to him. आसन के मेडिटेटिव आसनास मैंने डाले हैं, स्वस्तिकासन, वज्रासन, सिद्धासन एंड सुखासन। उसके बाद में हम प्राणायाम करते हैं। धारणा, किसी भी एक वस्तु पर हमें कहीं तो हमें करना ही पड़ेगा कि हमारे ध्यान को एक जगह पे हमें रखना है और उसके बाद में फिर हमें ध्यान करना है। अभी ध्यान में इसमें मैंने चैंटिंग ऑफ ओम इसलिए लिखा है क्योंकि मेरा इंसोम्निया पर मेडिटेशन ऐसा एक टॉपिक था और मैंने उस पर कुछ काम किया था, तो उसमें मैंने ओम का ही चैंटिंग लिया था। इसमें हम लोग अलग तरह से भी ले सकते हैं, क्योंकि ध्यान के इसमें ध्यान यानी क्या है, तो तत्र प्रत्येकतानता, एकतानता होनी चाहिए कि जो विचार है वो एक ही विचार हो। फिर मेरे मन में ओम का है तो
हेलो
हेलो
हेलो मैम, आवाज नहीं आ रही है आपकी।
हॅलो जया मॅम.
हॅलो,
हा तुमचा आवाज. हॅलो मॅडम, जया मॅडम, जाने मॅडम आहेत का? त्यांचं प्रेझेंटेशन डिस्कंटिन्यू झालं ना?
हो, पण त्यांनी लीव्ह केलं म्हणजे काही
ओके.
नाही
And
माहित.
okay, okay. Dr. Jaya Daftardar, please let her in, madam, in the meeting.
पण त्या मला दिसत नाहीये.
Okay, 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 madam. I'll tell her.
मी तुम्हाला होस्ट कसं करता येईल मला?
You can go in the participants list and
हा, ask to start का?
madam, you can make me co-host.
So मी
Participants list you can go and you can click on my name and you can make me co-host.
नहीं, पार्टिसिपेंट्स मध्ये जाऊन
मैम बना दी आपको को होस्ट मैंने।
अच्छा, उनको
हाँ।
जया दफ्तरदार को भी अलाउ कर दीजिएगा।
और जया जानी मैम सडनली क्या हो गया?
She is joining now again. She has called me up. ये जया दफ्तरदार मैडम वेटिंग रूम में भी नहीं आ रही है ना?
नहीं मैम, नहीं है, मैंने वेटिंग रूम डिसेबल कर रखा है।
नहीं है, हाँ।
नहीं, आप उनको थोड़ा अलाउ करिए ना, वो 5 मिनट से वेट कर रही है वो।
मैम वेटिंग रूम डिसेबल्ड है, वो अपने आप ज्वाइन हो जाएंगे अगर वो ज्वाइन करेंगे तो।
अच्छा, पर वो कह रही है कि वो ज्वाइन नहीं हो पा रही है, और जया जाने मैडम भी ज्वाइन नहीं हो पा रही है। क्या प्रॉब्लम हो रही है पता नहीं।
मैम नेटवर्क में कोई दिक्कत होगी, मैंने तो वेटिंग रूम डिसेबल कर रखा है।
Hello, madam.
हाँ, yes.
This is Dr. Vasudha. Actually, in the morning, I was facing the same problem. So, can you ask her to just go to join meeting option instead of clicking on the meeting link? If she is having app of Zoom in her phone or in her laptop, clicking on that app and then asking to join, it will ask the meeting ID first and then it will ask the passcode. In that way, I joined in the morning. I was similarly having the problem. The screen was saying waiting for the host to start the meeting or letting you in. So you can try this option by telling her.
जया दफ्तरदार अभी भी ज्वाइन नहीं हुई है। यश,
नो मैम।
डॉक्टर वसुधा जस्ट ज्वाइन हुई है, हाउ कैन शी नॉट ज्वाइन? आई डोंट अंडरस्टैंड।
मैडम, उन्होंने किस नाम से किया है वो पूछ लो, क्योंकि जया दफ्तरदार नाम से कोई नहीं है।
Yes, even I have seen, yes, right.
हाँ, तो उनको पूछो वो किस नाम से है, तो लेकिन कोई भी नहीं है वेटिंग रूम में।
Nobody is in the waiting room.
या
हेलो।
Hello. Just a minute. Just a minute. Just give me some seconds. I'm communicating with her. I think एक अगर if in some minute, if 1 minute, if she doesn't join, then we'll have to move on, I guess. I think we will start with next speaker. So I would like to call upon Dr. Vasudha Paliwal. She is with us, I think.
Yes, ma'am, I'm here.
Sorry for the trouble and interruption to our delegates. Because Dr. Jaya was trying to join from US and she was trying since 5 a.m. there, US time. But I don't know what technical problem exactly she's facing, but she's not able to join anyhow. And then she has got some another program afterwards. So till then, if she's okay, she's able to join. So we will continue with her. And till then, we'll be continuing with Dr. Vasudha Paliwal, our speaker for today, sixth and last speaker for today. But then there was some interruption in Dr. Jaya Jane's network even, and she was not able to continue. She had some points of her lectures remaining, and if she is able to join, then she will be continuing after Dr. Vasudha. So I would like to call upon Dr. Vasudha. She is again an academician. She is assistant professor at Dr. Bharati, at Dr. Patangrao Kadam's BVDU, Bharati Vidyapit Deemed to be University, Pune. She is assistant professor at Sanskrit Sahita Siddhanta department. She is having academic experience of 12 years. Then she is having good academic qualifications. She is a postgraduate and PhD in Ayurveda from Bharati Vidyapit. Then she has done her diploma in Panchakarma from Tirak Ayurveda Vidyapit, Pune. Qualifications are academic qualifications are very good. She has got 15 research papers and 3 chapters to her credentials. Then she has written 3 books, have excessive work on Rakta Dushti, understanding and management based on Ayurveda principles evolving an integrative view. Then she has presented papers in national and international conferences on regular basis, and she is active in cultural and extracurricular activities along with academics, and she is in one of the academic council members and in charge in her university. So very glad to have Dr. Vasudha here. And today she is with us to present on an exclusive topic, that is karma, code of conduct, perception in yoga and other traditional medicine systems. So this is altogether another topic of interest for many of us, and she is here with us today to present on the same. So over to you, Dr. Vasudha.
Thank you very much, madam. A very good afternoon, everyone. Lots of best wishes for the International Yoga Day.
Hello, Dr. Vasudha.
Yes, madam. Am I audible, madam?
Dr. Vasudha.
Yes, yes.
Yes, am I audible, madam?
Yeah.
Okay. Should I start my presentation?
Yeah, ma'am. You can start.
Okay. Thank you very much, madam, for such a
Am I
nice.
audible, Dr. Vasudha?
Yes, madam, you are audible. I am starting my presentation. A very good afternoon, everyone. Lots of best wishes for the International Yoga Day. I really want to congratulate the organizers today for this Yoga Multifacets Evaluating webinar, and thanks a lot for giving me an opportunity to talk here. Thank you, Dr. Sheetal Madam and Dr. Naveen Chandra Joshi Sir from Ayush Darpan Foundation. And thank you to Datta Meghe Institute of Ayurveda Hospital and Research Center, Nagpur, Principal Dr. Harshala Razurkar Madam, for giving me an opportunity here to talk. Today's topic of my presentation is Karma, the Code of Conduct, Perception in Yoga and Other Traditional Medicine Systems. Here's the disclaimer. Concept of karma, that is code of conduct. The code of conduct is explored with its three main classifications, that is the physical, verbal, and psychological. Every head contributes for a positive or negative effect on body. The principle of karma phala is a Sarvatantra principle accepted by all. It actually focuses on interrelation of all elements of consciousness that are mutually influencing each other, and recommends that we have to grasp and grab the ethical way to conduct ourselves as matured beings for a long and healthy life today, tomorrow, and even after possible rebirth. Evaluation at the end of these presentations will be, in this era of unpredictable presentation of unknown etiological symptoms and thereby life, few add-ons to the lifestyle modification concept by acceptance towards the action of cosmic energy, which is actually giving us reactions as per conduct, as per our conduct, can be a path illuminator for better predictions and positive results. It is actually practiced in the form of oneness theory, and the shades of it in different traditional medicine systems are explored in this presentation. From yogic perspective, karma is yogaha karmasu kaushalyam, the ability to perform with skill. Actually, it is the approach of non-bondage, non-yielding positive negative effects, but can be applied today to achieve maximum positive or minimum negative effect. Ashtanga Yoga, as on slides, depicts the real art and ethics of yoga. Without these ethical principles, yoga cannot lead us to its final aim of liberation. From these 8 angas, the first 2, that is yam and niyam, they are the ethical practices. Asana is physical practice. Pranayam and pratyahar are sensorial practices. Dharana, dhyan, and samadhi are mental practices. One must note that every step is postulating the idealism of conduct, like the yama, niyama, which easily go missed in a busy and competitive world. Also, we need to notice that pratyahar, that is withdrawal of senses, is considered utmost importance for achieving higher practices. After all, to control the chitta vritti is the real and final achievement of yoga. From the exploration of Ashtanga Yoga steps, it can be seen that good conduct forms the substance of yogic sciences, which has special focus on the concept of self-realization. It states that the mental, emotional habit of getting identified with our specific body, mind, belongings, and relationships is really a deep misidentification, which keeps us caught to our behavioral channels. This causes us to experience sorrow again and again. All divisions and forms of yoga have a thorough, honest life as their foundation, and such a life is directed by the principle of dharma, which means morality, law, order, and virtue. However simple a particular yogic method may be, it requires a deep pledge based on self-restraint, and this self-restraint is nothing other than the logical thought line of karma. Coming to the Ayurveda science, Ayurveda science has n number of references in which karma, the ethical code of conduct, can be referred. You can rightly see in the very first sutra of very first chapter of Ashtanga Hridaya, where Ragadi Rogan Satatanu Shaktan, this sutra is there. Here, Acharya tells that actually the different types of diseases are caused in a human body just because the Raga Ityadi, the Kama, Krodha, Raga, Lobha, Moha, these factors are becomes dominant on his body, and they result in mistakes being committed by the human beings, and in this way they face the sufferings. While describing a very important sutra of Sarva Vyadhi Nidan, the stalwarts of Ayurveda have given a Vyapak sutra with extensive scope. It covers all possible causative factors that can yield sufferings to mankind, as on slide, the Kalartha Karmanam Yogo Hina Mithyati Matrakaha, Samyak Yogasya Vidnyeyo Rogarogyeka Karanam. In here, the karma concept carries utmost importance. Karma is nothing but the act or conduct and the indulgence of a person in modes of conduction of acts in a qualitative or quantitatively less manner, wrong manner, or excessive manner leads to suffering, while the samyak, that is ideal, ethical manner, leads to a maintained life. Next is, in context of Swasthya Rakshan, the Dashavidha Papa Karma have been described. These 10 scenes, as on slide, Hinsaste, Anyatha, Kama, Paishunya, Parusha, Andruta, and all, these 10 scenes pertaining to the body are pertaining to body, speech, and mind. They are asked to be avoided. Himsa, that is causing injury, Asteya, that is stealing, Anyatha Kama, that is unlawful sexual activity, desiring for others, Paishunya, and so on. They are actually, you have to notice that these things are actually practiced in today's era in much manner, and they go unnoticed. People hardly realize that they are actually doing the Papa Karma, and these karmas are going to cause some of the other suffering to the human body. These sufferings can be avoided by following the Ayurveda principle of avoiding this Dashavidha Papa Karma, that is Sadrupta, which is nothing but the ethical code of conduct. Then Samatvam Yoga Muchyate, in yoga, it is described that Samatva is yoga. Actually, Samatva, that is no wrongness. I mean, Samatva, that is which is not much, which is not more or less, and which is perfect. So no wrongness in every act can be achieved through the obedience of Aptavachana. And in Ayurveda, the perfect obedience towards the rules of conduct of Dinacharya, Ritucharya, Trayopastamba, Sadrutta, Pathya Vichar, etc. also are the depictions of Karmasu Kaushalya and Samyak Yoga of Karma. Then in the concept of Arogya, this sutra, Nitya Hitahara Vihara Sevi Samikshakari Visheshu Asaktaha Data Samaha Satyaparaha Kshamavan. So here the sutra actually covers the entire scope of threefold karmas and confidently nominates it for a complete health. Next is the concept of Adharaniya Veg. The urges are asked to be suppressed forcefully, and these are stated to yield positive benefits in this life as well as in Paralok. Next is the concept of Karmaj Vyadhi. Here, Ayurveda, this is the uniqueness of Ayurveda, that Karmaj Vyadhi are described with their symptoms as well as treatment. Here, the Karmaj Vyadhis are caused due to all the possible karmas, all the possible conducts that on physical, mental, psychological level that a person has done. And here, the presentation of this Vyadhi is such that they usually have profound symptoms, and they are caused due to combination of bad deeds as well as indulgence in the causes of diseases. These also, while treating these Vyadhis, it is important that efforts should be made or attempts should be made to do something in order to cause reduction in the karma related factors of that person. Then and then only the dosha chikitsa will be found yielding results. Otherwise, it is not expected that only the dosha chikitsa can yield results in this Vyadhis. Then the Manodosh and Manodosh Aushadha, that is Dhi Dhairya Atmadi Vidyan, is actually known to us. And it is also depicting the code of conduct only. Next is the Sovarikpa system. In Sovarikpa, a holistic view of a person is highlighted while describing the basic philosophy and the causes of illness and treatment approaches. This inevitably gives importance to the concept of Sadrutta and thereby to the healthy state of body and mind. While describing the factors of illness, Sovarikpa scripts state that the illnesses are produced by misuse of mind, body, and speech. And the main source of every type of suffering or illness is considered to be marikpa or ignorance. Here, two main divisions in the causative factors of illness could be found. They are the long-term and short-term causative factors, and amongst them, the former is said to include marikpa. This simple ignorance causes three mental poisons, that is desire, anger, and delusion. Sovarikpa follows Buddha's Four Noble Truths, which smear to the diagnostic sense of suffering. From Buddhist viewpoint, physical illness is inextricably bound with mental, social, and spiritual illness. In general, the Sovarikpa doctors assesses both the physical and psychological environment in which the person lives. And there is a theory of 5 Tibetan Sovarikpa rites also. The rites are said to be similar to the yoga that originated in India, but the stress is a continuous order of movement, vinyasa, while in yoga, the still positions are respected. It benefits a person with increased energy, stress decrease, and improved sense of calmness, lucidity of thought, amplified strength, and flexibility. These results in a total upgradation in health and well-being, wealth, and happiness. Next is the Korean Oriental medicine. Korean Oriental medicine respects the ideology of self-discipline. The basic theory of Korean Oriental medicine is Taoism. Taoism emphasizes living in harmony with Tao. Term Tao means way, path, or principle. Principle says that humanity should follow the earth, earth follows the heaven, heaven follows the Tao, and Tao follows what is natural. In short, the harmony with nature is the principle which is obeyed by Korean Oriental medicine. Both Taoism and Buddhism believe in reincarnation, which means the life after death, and both have similar ultimate goals also. So the life after death is supposed to or is expected to get affected due to the conducts or karmas contributed in the previous life. Confucian ethics or Neo-Confucianism is based on the association of humankind to the heaven. Doctrines of Confucianism include search for the unity of self and Tian, that is heaven or God of universe. Concept is that individuals can realize their humanity and become one with the heaven. While describing the treatment for illness, that is physical as well as mental, the thoughts, beliefs, values are believed to act as the backbone of therapy. The moral spiritual model of Confucian ethics are described by promotion of features covered by 5 constants, that is Wuchang. They are Rain, Yi, Zi, Zin. That is humanness, righteousness or justice, proper right, knowledge, and integrity. And the 4 core concepts obeyed in here are the Han, that is deep grief and resentment, Jiong, that is strong feeling of affection or attachment, Neonch, that is intuitive perception, Hang, that is intrinsic sense of joy. Hence, all the mentioned ethics have a definite role to play in the Korean consciousness through the path of good code of conduct. Next, in the Mongolian medicine, more focus, while describing therapy of diseases according to Mongolian medicine, the more focus is on spiritual aspect, which is considered important. This demands a tinge of good code of conduct. Mongolian medicinal treatments are founded on discovering the body's balance through a man's spiritual coordination and the natural environment. Even currently, some Mongolian medical doctors and Buddhist monks too, specifically in Outer Mongolia, they rehearse daily prayers, they meditate, execute ceremonies, confer blessings, and serve the worshippers with remedial sacraments to repel adversity and sickness. Many draw horoscopes also and makes astrological calculations. These physicians give patients blessings to promote physical, emotional, and mental congruence. They struggle to stress relieving despair, emotive upsets, and adverse states of mind. Thus, the good code of conduct is practiced in a different shade in Mongolian medicine. Coming to the Siddha system of medicine, here in Siddha system, the good code of conduct or karma concept is found embedded in the belief of interdependence of body and soul. An important principle is Arivu, that is wisdom of self-realization. The 3 major influences on Siddha system of medicine are Ayurveda, Chinese, and Taoism. Hence, importance of code of conduct can't be missed here. The treatment in Siddha medicine is meant for keeping the 3 humors in evenness, where a proper diet, a disciplined regimen of life, and medicine together are advised for healthy living. Some of the factors assumed to affect the equilibrium are psychological and spiritual factors also. These are 2 Vinay, that is acts, good acts or null Vinay, and bad acts or Divinay. 3 Malam, 3 impurities of soul. Annavam, Kanmam, and Mayai. And the 8 ragam, as on slide, the Kamam, Krotham, Ulbonam, intense or strong desire, lust, that is Moham, and so on. The code of good conduct gets its obvious importance to reverse the lack of equilibrium caused due to the psychological and spiritual factors in here. Coming to the Unani system of medicine, here in Unani system, the Asbabe Satta Zaruriya concept is there. Here, the 6 essential components of life are respected the most. Here, the components essential for maintaining of health are basically these 6 essential components, without which the life of humans is unimaginable. Any disturbance or imbalance in one of the factors is known to cause disease, and they affect human health by affecting core body temperature or vital heat. These factors could be seen on slide as Hawa, environmental factors, Makulba, mushroom, food and beverages, etc. Here, the Harkat pa Sukune Badani, that is movement and rest of body. Can anybody tell the person to mute?
Yes, I'm just looking at it. You please continue.
The concept Harkat pa Sukune Badani, that is movement and rest of body, and Harkat pa Sukune Nafsani, that is psychological factors. Then Navam va Yakuza, that is sleep and wakefulness. And as on slide could be seen, here particularly the movement and rest of body related factors, psychological factors, sleep and wakefulness, retention and evacuation could be found related with the good code of conduct. Here, the above concepts are similar to the following concepts in Ayurveda, respectively, the importance of Vata, Ahar Vihar, Manas Hetu, Nidra, Adharaniya and Dharaniya Vega. All these aspects actually obey the righteous method of conduct to adopt the healthy lifestyle and stay healthy as long as possible. Thus, from the 6 essentials of life in Unani system, the ideology of Karmasu Kaushalyam and Samatvam can be grasped. Last is the traditional Chinese medicine system. The karma concept is also found inert in the fundamentals of traditional Chinese medicine, particularly in terms of Qi and Shen. Qi, the life force, is translated as vital energy for the physical and spiritual as well as psychological levels. TCM, that is traditional Chinese medicine, describes human physiology and psychology in relation to the Qi by linking Qi with particular mental and physical processes and emotive states. In the disease-related factors, along with other factors, mind status is given utmost importance. The internal causes are described to be the 7 emotions, viz., joy, anger, brooding, sorrow, fear, fright, and grief. And these are tangentially linked with Qi. The concept of Shen, that is spirit, it corresponds to soul, though resides in the heart, still it can be translated as spirit or mind. Shen implies our consciousness, mental functions, mental health, vitality, and our presence. Also, the emotion and theory of 5 elements. It is the interrelation of emotion and 5 elements. On the slide, it could be seen the 5 elements are considered in Chinese medicine as wood, fire, earth, metal, and water, and the emotions that are related with the increase or decrease of these 5 elements within body are the emotions of respectively anger, joy, worry, sadness or grief, and fear. So this was a very different topic for today's presentation, for today's webinar. So many aspects of yoga are highlighted and discussed. The karma aspect is also described in yoga with utmost importance, and in the same way it is respected in all the traditional systems of medicine also. So from presentation of my presentation today on karma, the points to carry could be: the concept of karma as an ethical code of conduct is well recognized as playing a dynamic role in health maintenance and disease cure in almost all the traditional systems of medicine. It is the exclusiveness of traditional systems in comparison to the conventional medicine. The concept of karma is explained with an outlook of discovering the importance of healthy mind for a healthy body. This perception can be regarded as a device of utmost importance in today's era for prediction of our sufferings and even for treating them. On the top of everything, for attaining crucial goals of self-realization, or liberation. So thank you one and all. From that, I can just stress on a point that circumstances are beyond human control, but our conduct is in our own power. So karma or the code of conduct should be respected at most. That is the ideology of yoga and all of us also. Thank you. Thank you one and all. Thank you to all the attendees as well as organizers of this seminar.
Thank you very much. Am I audible?
Yes, madam.
Thank you very much, Dr. Vasudha, for a wonderful ride of knowledge through other systems of medicine. Particularly you have highlighted on the karma aspect, which has been the talk of nowadays. It has been the talk of the town, and everybody is trying to make a research on the karma concept in Ayush fraternity particularly. So this has been a very discreet talk, and thank you very much for highlighting all the aspects you have tried to do very briefly. You have done it, but then it was altogether a novel concept for all of us. So thank you. Thanks again.
Thank you.
And now moving further, we have with us Dr. Jaya Daptardar now. Dr. Jaya. Dr. Jaya Daptardar. So we are moving ahead to our valedictory session straight, because Dr. Jaya has joined us all the way from USA. And Dr. Jaya was talking to me that there was some trouble in her network, and that's why she couldn't join since last half an hour. She was trying to do so, and that was almost 4:45 a.m. over there. And still she was very much enthusiastic, and she is enthusiastic to join even, and she has seminars lined up after this one. But still we are very much glad to have Dr. Jaya here. Dr. Jaya, are you there?
Yes.
Yeah, thank you so much.
Thank you.
So this is Dr. Jaya all the way. She has joined from US, I repeat, and this is now that we are having you here. It was almost half an hour to 45 minutes struggle for us to make you be present here on this platform of the International Web Conference on yoga therapy, various aspects. So as per my communication with Dr. Jaya, she had so many programs lined up for her, and still she was enthusiastic to join us today. And with our chairperson, Dr. Varshney sir's permission, I'm taking this valedictory function. I'm getting it started with Dr. Jaya's talk. So there will be a brief introduction of Dr. Jaya Daptardar. She is an entrepreneur, healthcare executive, speaker, leader. She is an Ayurvedic doctor and has a master's in healthcare administration and management in the USA. She has been highlighted by multiple magazines, newspapers, and television in USA. She is an author of 3 books, passionate about beauty care in Ayurveda. She is a recipient of Dharma Award and Community Service Award from Doctors Association in USA. She has been practicing and teaching Ayurveda in the USA for 20 years. Besides her work in Ayurveda and wellness world, she also works as a chief operating officer of a healthcare company and serves multiple boards. And Dr. Jaya will be delivering her brief talk today on International Yoga Day celebrations and how they celebrate there in US, and her perspective on that. So Dr. Jaya, welcome here, and over to you.
Thank you. And namaste. Thank you for a wonderful introduction as well, Dr. Sheetal. So, happy International Yoga Day to all of you. It is an early morning here, and I live in New York area. So International Yoga Day, also known as World Yoga Day, and it is celebrated on June 21st, actually, every year since 2015. And in United States, we celebrate on the nearest weekend to that. So due to the busy schedule on the weekdays and all. So I was a part of the first Yoga Day celebration at Harvard University, Cambridge, Massachusetts School of Medicine, when Dr. Shripad Naik was there and Sri Gurudev Sadhguru was there, and many others. So it was my pleasure to be a part of that conference and the panel discussion after the seminar. So I'm celebrating the Yoga Day at my center today, and also invited to a few other celebrations as a guest. We celebrate Yoga Day as the same way as you all celebrate in India. Most of the organizations related to yoga and Ayurveda celebrate here according to their time schedules and the themes. So it is my pleasure to be here today, all Ayurveda and yoga scholars from India. I really appreciate the efforts and hard work that Ayush Darpan is doing in sharing the profound knowledge of Ayurveda. It is so important, but it takes a village. So hats off to all of you, and especially Dr. Sheetal for organizing and communicating with me. So on this occasion, I'm going to talk about the wonderful relationships between yoga and Ayurveda. We call them like sister sciences. Yoga and Ayurveda are sister sciences that have been united for thousands of years for the sake of healing body, mind, and soul. They share the same Vedic roots. Ayurveda deals with the health of the body, while yoga deals with purifying the mind and consciousness. But in reality, they complement and embrace each other. So both the practice of yoga and Ayurveda go hand in hand, as they both stem from the same Vedic system that has been oriented and that has been originated thousands of years and born from the same Vedic scriptures. They have the same underlying principles and belief that leads to holistic well-being of the individual. While yoga deals with harmonizing of mind, body, and soul, Ayurveda takes care of the person's both physical and mental well-being through the means of diet and lifestyle changes, as you have heard from many other speakers today. So if we integrate the Ayurvedic principles with your yoga practice or our yoga practice, we achieve the perfect wellness. So the ancient rishi, masters of all Vedic sciences, and they understood that good health is great asset in self-realization. If the care of physical body is neglected, it can easily become an obstacle to the spiritual practice. So both yoga and Ayurveda are mutually related to each other. And they offer their preventative tools to heal various imbalances in the body, disorders, as well as they offer detoxes, rejuvenation techniques for the body and mind. When you blend the principles of Ayurveda with yoga, you greatly enhance the healing power of Ayurveda. So the complete union of yoga and Ayurveda is the complete treatment, I would say. So Ayurveda is science of life, a science of physical and mental wellness for the perfect health. And yoga is the tool that the people use to reach the enlightenment and free their minds. Both systems have many similarities in relation to attitude, nutrition, diet, lifestyle management, hygiene, exercise, cleansing and detox practices as well as the spiritual practices. So that is the reason yoga and Ayurveda both have inseparable relationships, I would say. And they both share the same principles. So Ayurveda is all about knowing your body constitution and doshas and then make some lifestyle changes according to it. Each and every one of us has unique constitution that is governed by, our physical and emotional makeup as well as lifestyle pattern. So Ayurveda recommends to make changes and practice certain treatments that help in achieving harmony between the doshas and with the nature. Similarly, yoga includes the various methods like the practice of yoga asana with various breathing exercises, pranayama that helps in calming the mind and at the same time put us in the harmony with the nature to achieve the healing of the body and mind. So in yoga practice, different yoga poses serve different purposes in the body to help maintain the balance in the doshas, such as like forward bending yoga poses helps in pacifying pitta dosha. For example, yoga poses that involve twisting yoga or rigorous type of yoga help in balancing kapha dosha because kapha is heavy, and backward bending poses help in maintaining vata dosha. So both the principles of yoga and Ayurveda focuses on being in tune with their bodies and utilizing the healing power of nature to get the best results. And at the end of the day, they both have same goals. So the ultimate goal of both yoga and Ayurveda is to help you in becoming healthier and balanced. If you are healthy, you're healthy when your mind, body, and soul are in balanced state, and you're in perfect harmony with your environment. So the practice of yoga and Ayurveda help you to attain that perfect harmony that we're talking about. Hence, combining these both disciplines will enhance your sense of well-being to the highest level. So what is the actual yoga and Ayurveda relationships if you compare? So Ayurveda and yoga both are originated from a mother, ancient Vedic sciences. Yoga originates in Yajurveda, while Ayurveda originated from Atharva Veda and Rig Veda. Both sciences recognize that keeping the body healthy is vital for fulfilling the 4 aims of life. So what are the 4 aims of life? Dharma, duty, artha, karma, desire, kama, desire, and moksha, liberation. So both sciences talk about the balance of doshas, dhatus, that's tissues, malas, waste products, is essential for maintaining a good health. Both recommend the use of Ayurvedic nutrition, herbs, asana, pranayama, meditation, mantras, and daily rituals for wholesome entire being. So, and both sciences encourage physical health as a good foundation for mental, emotional, and spiritual well-being. Both share the same view on psychology, and that is very important. They both understand that the body-mind imbalance is the root cause of all sufferings, and that is the ultimate essence of health is experienced when we abide in our true nature, which is total peace, regardless of the state of the physical body. And both sciences uses detoxes or the cleansing methods in a different way for removing the waste products and toxins through their natural routes of elimination. For example, Ayurveda has Panchakarma therapy, 5 cleansing actions, and yoga uses 6 karmas, 6 purification measures for the mind cleansing. So I think I don't have much time. Thank you all for putting together this Yoga Day event today. And thank you, Dr. Sheetal. Thank you, all Datta Meghe Ayurvedic Medical College team, Sagarji Meghe, Principal Dr. Harshala Rajurkar, and I don't want to forget Dr. Naveen Joshi. So you all are doing a fantastic job of spreading the word of Ayurveda in the world. I apologize for not attending the whole function due to my hectic schedule, but I'm very glad to be a part of it. So wish you all a very happy and healthy life. And namaste.
Thank you. Thank you, Dr. Jaya, for a brief and wonderful talk of yours. And you are very much enthusiastic, and you are a stringent follower of Ayurveda, I guess, there in US, and doing a very good job. You are doing such a nice job that you are working towards the empowerment of Ayurveda over there abroad. And we are proud that you are part of even the conferences and seminars, whatever we are celebrating here in India. Even you are enthusiastically participating and managing time to be here with us and sharing your thoughts and knowledge here even. So thanks again, and thank you for joining this forum today here on this 7th International Yoga Day celebrations. So she is again the part of Ayush Darpan family, and she had delivered many lectures here on this forum. And now we would like to move ahead, and I would like to invite Dr. Jaya Jane ma'am. And she was actually, due to some technical errors, she was abruptly out of
ma'am, you are not audible.
Hello. Hello. Is it okay, ma'am, now? Hello.
Okay, you are audible. Sheetal, you are audible.
Now you are audible.
Previously, I was not audible, ma'am, as you said. When I was thanking Dr. Jaya, whether I was audible or not.
Yes, you were audible, madam.
Audible, Sheetal.
Okay, ma'am. Okay. So I would like to call upon Dr. Jaya Jane ma'am, and she was abruptly out of the meeting due to some technical errors, and now she is with us. So she would like to continue with her talk, and I requested her to conclude her talk by her remarks and her remaining presentation. So over to you, Jaya ma'am.
Okay. Thank you, Sheetal. पंचकोश के बारे में जानने के बाद में हम लोग ध्यान के बारे में बात कर रहे थे कि किस तरह हम मनोमय कोश में और सारे कोश पर हम लोगों के लिए रेमेडी वो सिद्ध होता है। ध्यान के बारे में मैं बात कर रही थी कि तत्र प्रत्येक तानता ध्यानम, एक तानता हम में होनी चाहिए। ये मैं एक बात यहाँ पे कहना चाहती हूँ कि ध्यान का मतलब ये नहीं है कि हम ओंकार जप या सिर्फ इसी चीज पर कॉन्सेंट्रेट करें, तो हम और किसी भी चीज पर जो लक्ष्य है हमारा, किसी का कोई भी लक्ष्य हो सकता है, तो उससे क्योंकि हमें मन शांति प्राप्त होगी और वो लक्ष्य हमारा जो है वो अच्छा होना चाहिए, क्योंकि हम जानते हैं मन ये सत्व रज तम युक्त होता है। और किस बात का मैं ध्यान कर रही हूँ, मुझे किस चीज का ध्यान करना चाहिए, ये बुद्धि उस साधक में होनी चाहिए, क्योंकि रज और तम के खेल में सत्व बहुत बार मार खा जाता है। इसीलिए इस सत्व को उभारते हुए हमें चिंत्य, संकल्प, विकल्प ये सब देखते हुए स्व जिसे कहते हैं, ये स्व को हमें पहचानना चाहिए। इस स्व को जब हम पहचानते हैं तो उसे आत्मज्ञान कहते हैं, और इससे भी ज्ञान श्रेष्ठ कहा है। भगवत गीता में वचन आया है, ज्ञानात ध्यानम विशिष्यते, यानी जो ज्ञान है, स्व का जो ज्ञान है, मैं क्या हूं, ये यदि मैंने जान लिया, अहम ब्रह्मास्मि जो कहते हैं, सोहम जो हम लोग कहते हैं, तो उससे भी श्रेष्ठ ये ध्यान कहा गया है, भगवत गीता का वचन है, तो इसलिए ये ध्यान हमें करना चाहिए। तत्र प्रत्येक ध्यानम। एक्सपेरिमेंट्स ऑन योगिक मेडिटेशन बहुत सारे हुए हैं, तो उसमें दिल्ली में भी हुए हैं। ऑक्सीजन कंजम्पशन है उसमें, कार्बन डाइऑक्साइड आउटपुट, बेसल मेटाबॉलिक रेट, पल्स रेट, इलेक्ट्रोकार्डियोग्राफी एंड इलेक्ट्रोइंसेफेलोग्राफी चेंजेस, उसमें चेंजेस इन गैल्वेनिक स्किन रेजिस्टेंस है, एनर्जी एक्सपेंडिचर है, तो ऐसे काफी सारे चेंजेस उसमें आते हैं कि वेरिएशंस है। तो इन बातों की स्टडी ध्यान पर हो चुकी है। और एक मैं बात कहना चाहूंगी कि ब्रेन वेव्स जो है उसमें भी मेडिटेशन के वक्त अल्फा वेव्स ये रहती है, तो इस पर भी दिल्ली में स्टडी हो चुका है। योग के जरिए, मैंने जो इम्पोर्टेंस ऑफ योगा बात कर रही थी, तो योग के जरिए हम मेकअप कर सकते हैं। यूं तो हम लोग हमेशा करते हैं, लेकिन मेकअप का मतलब क्या है कि जो भी कमी है उसे हम भर सकते हैं, उसमें से हम लोग उभर सकते हैं। तो उसके लिए शारीरिक स्वास्थ्य की हो या मन स्वास्थ्य की हो, हमें समय नहीं मिलता है स्वास्थ्य के लिए, कॉलेज है, ऑफिस है, पढ़ाई है, ऐसी दुविधा से निकल के चैलेंजेस है लाइफ में, तो अपॉर्चुनिटीज भी है। तो अभी समय है, इसलिए हमें खुद को ही एनालिसिस करना चाहिए और इनिशिएटिव लेना चाहिए कि हम योग करें, हम मेडिटेशन करें, हम प्राणायाम करें, ताकि हमारी जो सोच है वो सकारात्मक हो और हम इस वर्तमान काल में तरह से जीना सीख जाए। क्योंकि हम सारे पेरेंट्स जब होते हैं तो हमें भी ऐसे लगता है कि हमारा जो बच्चा है वो हमेशा एकदम, यानी उसको विश्वनाथन आनंद की जैसी बुद्धिमत्ता होनी चाहिए, वो अमिताभ बच्चन के जैसे एक्टिंग करना चाहिए, राहुल द्रविड़ जैसे क्रिकेट खेलना चाहिए, ऐसे हर चीज उसमें परफेक्ट होनी चाहिए, ऐसे हम सोचते हैं। सचिन तेंदुलकर जितना संयमित है वैसे होना चाहिए, अब्दुल कलाम जी की प्रतिभा होनी चाहिए, ऐसे हमेशा हमें लगता है। लेकिन जब हम उसे एक रिस्पॉन्सिबल पर्सन के रूप में देखना चाहते हैं, तो हमें सबसे पहले उसे योगा के लिए, योग ये लाइफस्टाइल में उसके डालना पड़ेगा। योग करना जरूरी है, जैसे मैंने पहले भी मेरे प्रेजेंटेशन में कहा था कि ये खुद अनुभव करने की वस्तु है। ये हम लोग, किसी ने कहा 2 दिन योग कर लिया, जून मंथ है, 21 जून है, बस कर लिया। अभी तो फिलहाल बहुत सब जगह योगा योगा ही चल रहा है, तो उसमें से निकलते हुए हमें हर साल, पूरा साल हमें करना है और उसे एक हमारे दिनचर्या का एक पार्ट उसे बनाना है कि भाई सुबह उठते से ही पहले हमें उसे करना है। नर ध्यान दे वह ध्यान में, नर ध्यान दे वह ध्यान में, फिर ध्यान ना हो ध्यान में, हो मस्त अपने स्थान में, ना दूर हो फिर जान में, नहीं ध्यान ध्याता ध्येय भी त्रिपुटी परे चढ़ जाएगा, यह ध्यान का ये इश्क तेरा तब सफल हो जाएगा। ये तो मैंने राष्ट्र संत तुकडोजी महाराज की पंक्तियां सुनाई, लेकिन उसमें भी ध्यान का ही महत्व कहा है कि जो लक्ष्य हमारा होता है, क्योंकि हम जो कहते हैं लॉ ऑफ अट्रैक्शन, तो वो काम करेगा ही, तो इसलिए हमें अच्छा लक्ष्य रहना चाहिए और हमेशा स्व में स्थित होते हुए ध्यान, धारणा, प्राणायाम, इन सारों को हमें अपनाना चाहिए, क्योंकि समाधि हमारे बस की बात नहीं है और इसके सारे इन बातों की फिजिकल एंड मेंटल इस पर जो इफेक्ट्स है वो हमें तभी मिल पाएंगे। इसलिए कहते हैं अपने आत्म के चिंतन में हरदम जागरूक रहना है। भाई मेरा स्वास्थ्य कैसा है, इसलिए मुझे हरदम जागरूक रहना चाहिए। अपने आत्म के चिंतन में हरदम जागरूक रहना है। ओहम सोहम श्वास से अपनी अंतर दृष्टि निरखना है। चंचल मन को बुद्धि विचारक शुद्धि सतत ही करना है। निश्चल कर वृत्ति की धारा अंतर्मुख में स्थिरना है। मैं क्या हूँ, मेरी हेल्थ क्या है, ये यदि हमें जानना है, इसे यदि पहचानना है, तो हमें योग करना चाहिए। इतना कहते हुए मैं यहाँ अपनी वाणी को विराम देती हूँ। थैंक यू डॉक्टर शीतल।
Thank you, Jaya ma'am, for a wonderful poetry by Rashtra Sant Tukdoji Maharaj, and you have concluded it very well. I think you had more on your side to present today, but then we will manage to call you upon some other occasion, and I will get your talk completed on this forum. So
Okay.
thank you so much.
No problem, no problem.
Because technical errors
Yeah,
occur
yeah.
sometimes, and
these
I
are
can
the
understand,
things,
no problem.
these are the things which are beyond our limits, and
Yeah.
these are the things we have to manage. So thank you, thanks once again, and now it's time for the chairperson's remark, and it's a pleasure for me to have, pleasure for all of us to have Dr. Subhash Chandra Varshney, sir, Professor Emeritus and ex-professor and head Shalya Tantra Institute of Medical Sciences, Banaras Hindu University. So sir is my doctoral research guide, and I am very much pleased, I am very much honored to have Dr. Varshney sir as my guide. He has been inspiration for me to work on my doctoral research project, and it was study of inflammatory markers on in patients of arthritis treated by leech therapy. Sir is instrumental in inspiring many students to perform research in the field of leech therapy, Charasutra therapy, and many other therapies in the field of Shalya Tantra. Sir needs no introduction at all. Sir has got his students all over India and abroad working in various fields, in various institutes of national excellence, and he is the surgeon par excellence. Sir has got special techniques of operating hernia and sort of daycare surgeries. He has performed thousands of surgeries and served many patients in the field of surgery. So thank you so much, sir, for being here again today. And sir is instrumental in attending the many web conferences, those who run for all day long even. Sir is with us since our first web conference on Rakta Mokshana, international web conference, which was organized by Ayush Darpan. And sir was there since then, and he is there in every conference we have arranged till now. And there are 3 international web conferences, and this is the 4th one today, and 3 national web conferences apart from this. So sir has been with us, and sir has chaired the surgery lecture series on Ayush Darpan, which was extremely successful, which included 60 guest lectures almost, and sir has chaired all the sessions. So my list will be endless, but then people want to hear you, sir. And over to you for your chairperson's remark today. Thank you so much, sir. Over to you.
Okay. Thank you. Am I audible?
Yes,
आवाज आ रही?
Yes,
मेरी
sir.
आवाज आ रही?
Yes,
Hello?
yes, sir. You are audible. You are audible.
तो पहले तो सबसे पहले शीतल मैडम को बधाई हो। बहुत अच्छा आज का ऑर्गेनाइजेशन किया, और हमेशा की तरह उन्होंने जैसे बताया सर्जरी सीरीज, रक्त मोक्षण सीरीज और एनोरेक्टल सीरीज, तो बड़ा सफलतापूर्वक वो आयोजन करती हैं। और आज का जो वास्तव में पूर्व संध्या कहना चाहिए इंटरनेशनल योगा दिवस की, तो उसके लिए भी आपने बहुत अच्छा सफल आयोजन किया, तो मैं आपको पहले सबसे बधाई देता हूँ। आज के इस अवसर पर सबसे पहले सागर जी और नवीन जी 2 आयोजन करता हैं। सागर जी का बहुत बड़ा दृष्टिकोण है इस संस्था को बनाने में, और नवीन जी ने पूरे कोविड काल में पूरे आयुर्वेद जगत को जोड़ के रखा और सबको बहुत अच्छी तरह मौका दिया आगे बढ़ने का, तो वो भी बधाई के पात्र है। तो इंटरनेशनल योगा दिवस या दिन के ये पूर्व संध्या पर तो सबसे पहले जो बधाई के पात्र हैं, सबसे पहले वो तो नरेंद्र मोदी जी ही हैं, प्रधानमंत्री। अगर वो ना होते तो इंटरनेशनल योग दिन हम नहीं मना पाते थे। योग दिन मनाते थे, लेकिन इंटरनेशनल प्लेटफॉर्म पर पहुंचाने का पूरा श्रेय नरेंद्र मोदी जी को जाता। वो वास्तव में बहुत बड़े योगी हैं जी। उनकी दिनचर्या देखें तो वो योग निद्रा, हमारे किसी वक्ता ने बोला था, तो शायद योग निद्रा में ही रहते हैं, थोड़ी बहुत देर के लिए सोते हैं, बाकी पूरा दिन उनका देश की सेवा में जाता है। योगी को जो लक्षण बताए गए हैं कि भाई सुख दुखो समय कृत्वा लाभा लाभो जया जय, इतनी आलोचनाएं, इतना विरोध, इतना विपत्ति में अडिग रहने वाला, चीन जैसे देश को आंखों से आंख दिखाने वाला ऐसा योगी हमको मिला है। ये वास्तव में हमारा पूरा भाग्य है। हम लोग उसके लिए नरेंद्र मोदी जी को एक बार पुनः धन्यवाद देते हैं कि इंटरनेशनल प्लेटफॉर्म पर योगा को ले जाने वाला यदि कोई व्यक्ति है तो नरेंद्र मोदी जी। फिर जो हमारे लोगों के कंट्रीब्यूशन है योग को इंटरनेशनल ले जाने के लिए, सबसे पहला जो श्रेय है जाता है वो महेश योगी जी को जाता है। फिर उनके शिष्य श्री श्री रविशंकर जी, ये दो लोगों ने बहुत अथक प्रयास किया योग को आगे बढ़ाने में। ये भी सही है कि जो बाबा रामदेव जी ने अथक प्रयास किए हैं, उन्होंने भी इसको बहुत आगे बढ़ाया है, वो भी बधाई के पात्र हैं। ऐसे अनेक गुप्त चेहरे हैं, छुपे चेहरे हैं, जिन्होंने योग के द्वारा भारतवर्ष को इंटरनेशनली पहुंचाया है, और वास्तव में वो सभी लोग बधाई के पात्र हैं। आज का जो वास्तव में जो आरंभ हुआ, शीतल जी ने जो आरंभ किया बहुत अच्छी तरह किया, लेकिन जो प्रथम वक्ता थी माननीय श्रीमती श्री हर्षल राजूरकर शर्मा, उनके भाषण से पता चला कि उन्होंने पोस्ट कोविड की जो सही स्थिति थी या कोविड काल की जो सही स्थिति थी, उन्होंने अपने लेक्चर में बताई। कितने परिवार बिछड़े, कितने लोग एक दूसरे से अलग हुए, साइकोलॉजिकल कैसा आघात हुआ, कोविड का क्या प्रभाव पड़ा, कैसे लोग व्यथित हुए, इस बारे में उन्होंने बहुत बड़ा भाषण दिया। फिर कहा कि भाई पोस्ट कोविड सिनेरियो में लोग ठीक भी हो गए और फिर भी जो है मानसिक रूप से कहो, शारीरिक रूप से कहो, तो बड़े व्यथित थे। तो उसमें योगा का कंट्रीब्यूशन उन्होंने बताया, और ये भी सच हो चुका है आयुष डिपार्टमेंट के द्वारा, आयुष डॉक्टरों के द्वारा, जो 90% से जिनकी ऑक्सीजन लेवल ऊपर थी, उसमें आयुर्वेद और योगा का क्या योगदान रहा। लोग ब्रीदिंग एक्सरसाइज कहते हैं, योगा कहने में थोड़ी शर्म महसूस करते हैं, जो भी कहें, प्राणायाम ने वास्तव में कितने जीवन बचाए हैं, ये भी नहीं। तो प्राणायाम या योगा वास्तव में जो देखा योग का ही भाग है। बहुत अच्छा हर्षल जी ने बताया, और न केवल उन्होंने ये बताया कि भाई योगा एक आरंभ है, उससे पहले, योग से पहले अगर किसी को तैयार करना है तो यम नियम इत्यादि जो बताए अष्टयोग, वो भी उन्होंने बहुत अच्छा प्रकाश डाला। जहां तक मेरा व्यक्तिगत थिंकिंग है, अगर आदमी योग से पहले यम नियम का पालन कर ले, दो ही चीज का पालन कर ले, तो ये अहिंसा, जितनी हिंसा हो रही है पूरे वर्ल्ड में, वो हिंसा शांत हो जाए। आज चाइना ने जो वायरस दिया, यदि वो इसका पालन किया होता तो शायद ये अहित पूरे वर्ल्ड का ना किया होता। तो ये जो चीजें हैं, सॉरी एक मिनट, हाँ एक सेकंड, हेलो, हाँ थोड़ा डिस्टर्ब हो गया था, सॉरी। तो आ रही आवाज आ रही है ना?
हाँ जी सर।
हेलो,
यस सर।
हाँ
यस सर।
हाँ, तो मैडम ने जो बताया, वास्तव में ये यम नियम यदि पालन किए जाएं तो हम बहुत कुछ, आपस की दुश्मनी, आपस के द्वेष, आपस के जो कंपटीशन है, मेरी साड़ी उसकी साड़ी सफेद क्यों इत्यादि, बहुत सी चीजों से हम बच सकते हैं। आज आप देखेंगे विदेशों में, हमारे यहाँ जितने मंदिर है उससे ज्यादा वहां पर क्या है, साइकोलॉजी के हॉस्पिटल है, मेंटल डिजीज से लोग परेशान है। तो योगा उन हॉस्पिटलों को मंदिर में कन्वर्ट कर सकता है, योग का बहुत बड़ा रोल हो सकता है। मैडम हर्षल ने एक बहुत अच्छी चीज ऑब्जेक्टिव भी बताई थी कि भाई हम अब जो गाबा का लेवल जो है, उन्होंने बताया कि भाई उसका क्या प्रभाव पड़ता है योगा से। और इसके अलावा उन्होंने और भी बहुत साइंटिफिक चीजें अप्रोच बताई कि भाई स्ट्रेस मेजर होता है, योगा का सिंपैथेटिक पैरासिम्पैथिक नर्वस सिस्टम से क्या संबंध है। अल्टीमेट योग का जो एम है वो रिलैक्सेशन है, और उन्होंने अपने भाषण में बहुत अच्छी तरह ये सब बताई। सेकंड वक्ता मेरे साथ में रही है मैडम नीरू नथानी जी, बहुत अच्छी वो वर्कर हैं, बहुत अच्छा वो काम कर रही है योगा के क्षेत्र में। और आज उन्होंने जो मेटाबॉलिक डिसऑर्डर के ऊपर योग का रोल बताया, डाइट का रोल बताया, पंच जो है चीजें बताई उन्होंने, भाई जो खाने के लिए बताई, उनमें पंच जो क्या बोलने चाहिए इसको, सात्विक आहार, बार्ली, व्हीट, ग्रीन, मुद्ग, चना इत्यादि का जो बताया। और उसके अलावा योगा का जो वर्णन किया, तो ओबेसिटी, हाइपरटेंशन, प्री डायबिटीज, ये सब कंडीशन कैसे रोक सकते हैं, हमारा बहुत बड़ा रोल हो सकता है। आयुर्वेद का बहुत बड़ा रोल हो सकता है, योग का बहुत बड़ा रोल हो सकता है। लाखों लोगों का जीवन हम बचा सकते हैं जो प्री डायबिटिक डायबिटीज में कन्वर्ट होने जा रहे हैं, या हाइपरटेंशन वाले जो एस्टेब्लिश हाइपरटेंशन में कन्वर्ट, उन सबको हम योगा के द्वारा हम बचा सकते हैं। ये बहुत अच्छा नीरू नथानी जी का अपनी तरफ से बहुत ही अच्छा उनका वर्णन था। फिर मौन के ऊपर जो भाषण हुआ वनीता जी का, वो वास्तव में बहुत बड़ी ताकत होती है मौन में, और मौन से हमको इंटरनल शक्ति मिलती है, ये भी उन्होंने बताया बहुत अच्छा। रविदास जी ने पंचशील बोलना चाहिए, पंच जो है उनको बताया उन्होंने, पंचकोश के बारे में बहुत अच्छा उनका, बहुत ही बढ़िया उनका भाषण रहा। एक बहुत ही साइंटिफिक अप्रोच उनकी रही पंचकोश के बारे में। और उसके बाद जो है फिर जया जाने मैडम, अभी बाद में भी सुना उनका, बहुत ही अच्छा, उनका बहुत ही बढ़िया योगदान रहा, व्यक्तिगत कंट्रीब्यूशन बहुत अच्छा है, मैं उनको धन्यवाद देता हूँ। इसके अलावा एक और जो मैडम थी पालीवाल मैडम, उनका भी बहुत अच्छा लेक्चर था, प्रैक्टिकल अप्रोच थी कर्म के ऊपर, क्या करना क्या नहीं करना, डिफरेंट देशों में कर्म के द्वारा या उनकी क्या अप्रोच है, विभिन्न देशों का उन्होंने बताया। ये भी बहुत बड़ा आज का उपलब्धि है इस इंटरनेशनल सेमिनार। बाहर से हमारे साथ बहुत से लोग जुड़े, जया मैडम भी एक थी, उन्होंने बहुत अच्छा योग आयुर्वेद के ऊपर अपना प्रकाशन डाला। वास्तव में योग देखा जाए, योग इज ए लाइफ ऑफ, हमारा जीवन है, एक लाइफ वे ऑफ द लाइफ जीवन है। और हमारे हिंदुस्तान भारतवर्ष में तो ये दैनिक चर्या में लोग ले लिए हैं। और कोविड जैसे बोलते हैं अवसर कहना चाहिए एक तरह का, इसने तो लोगों को समझने को मजबूर कर दिया कि भाई आयुर्वेद और योगा दोनों एक बहुत बड़ा पार्ट प्ले कर सकते हैं। प्राणायाम जो कभी नहीं करते थे लोग, उन्होंने करना शुरू कर दिया और उसका लाभ उठाया, मरीजों ने लाभ उठाया, ये बहुत ही बड़ा कंट्रीब्यूशन है। शॉर्ट में प्रैक्टिकली मैं देखता हूँ, हम लोग बहुत अच्छी सर्जरी के सब लोग हैं, लासूकर भी हैं, तो सर्जिकल क्षेत्र में भी अनेक व्याधियां योग के द्वारा ठीक की जा सकती हैं, प्रिवेंट की जा सकती हैं, और यदि हो गई हैं तो ठीक की जा सकती है। मैं छोटा सा अनुभव, फर्स्ट और सेकंड डिग्री पाइल्स के मरीजों में यदि प्रज्ञा अपराध को रोक दिया जाए, खान पान की हैबिट ठीक की जाए, और खाली अश्विनी मुद्रा और जो है प्राणायाम, कपालभाति यदि योग किए जाए, तो फर्स्ट और सेकंड डिग्री पाइल्स जो हैं, यदि सेकेंडरी नहीं है प्राइमरी है, तो निश्चित ही वो इरिवर्सिबल है, ठीक हो जाते हैं और आदमी स्वस्थ रोग के पूरे जीवन में विचरित करता है। योगस्तु कर्मस्तु, योग कर्मस्तु कौशलम, योग जो है कर्म की कुशलता ही योग है। अब क्या दोनों अर्थ ले सकते हैं कि भाई कार्य, योग के द्वारा कार्य कुशल, अपने कर्म में कुशलता आती है, यदि चित्त वृत्ति निरोध हो जाती है, आप एकाग्र मन से कोई काम करते हैं तो निश्चित ही उसमें सफलता मिलती है। लास्ट में जीवन के उद्देश्य होते हैं, आप सभी जानते हैं, अब बहुत लोगों ने बताया, धर्म अर्थ काम और मोक्ष स्वास्थ्य का मूल कारण। स्वास्थ्य बिना लोगों का जग में व्यर्थ प्राण धारण है, ये किसी ने कहा है कवि ने। तो इन चारों का जो उद्देश्य है, धर्म अर्थ काम मोक्ष, इसके पीछे स्वास्थ्य है। और स्वास्थ्य जब ही मिलेगा जब हम अपना जो है दिनचर्या, रात्रिचर्या, निशाचर्या इत्यादि जो भी चर्या है, योग का पालन करें, समयोग से रहें, यम नियम का पालन करें, तो निश्चित ही हम सभी लोग पूरे विश्व को आने वाली व्याधियों से बचा सकते हैं, रोक सकते हैं, और एक बहुत बड़ा योग का कंट्रीब्यूशन हो सकता है। आयोजकों ने मुझे यहाँ 2 शब्द बोलने का मौका दिया, मैं उन्हें पुनः धन्यवाद देता हूँ। बहुत बहुत धन्यवाद। थैंक यू वेरी मच मैडम।
थैंक यू सो मच सर, बहुत बहुत धन्यवाद सर आपका। आपने बहुत ही आपका एक जो मास्टर स्ट्रोक होता है हमेशा, इससे हम प्रोग्राम को जो एक अलग ऊंचाई पे ले जाते हैं, हमेशा ये हम बहुत बहुत सराहा गया है इसको हमारे आयुष दर्पण प्लेटफॉर्म पे और हमारी सर्जरी फ्रैटर्निटी में एंड हमारी आयुर्वेदा फ्रैटर्निटी में, इसमें कोई दो राय नहीं है सर। और बहुत ही बढ़िया आपने विवेचन किया सर प्रोग्राम का। और आपने जैसे कहा कि कुछ योग मुद्राओं के साथ अगर हम प्रज्ञा अपराध और साथ में इंद्रियार्थ संयोग इनको अवॉइड करने को अगर पेशेंट्स को बोल दे, तो कुछ हमारी वेरी मच सर। और हमेशा हमारे बने रहे सर, आप हमारे आयुष दर्पण का एक बहुत अहम हिस्सा बन गए हैं अभी, और हमारे आने वाले प्रोग्राम्स में भी सर आप हमारे साथ जुड़े रहेंगे और आपका आशीर्वाद हमारे साथ हमेशा बना रहेगा। इसी कामना के साथ मैं बहुत बहुत धन्यवाद आपका करती हूँ सर। और सर आज के इस प्रोग्राम में हमारे साथ कुछ जो डेलीगेट्स जुड़े हुए हैं, उनमें कुछ एक्सपर्ट्स एक रिमार्क का हमने प्रोग्राम लिया हुआ है। तो इसमें हमारे साथ एक हरियाणा से जुड़ी हुई है डॉक्टर शीला मैम। तो डॉक्टर सुशीला मैम बहुत ही एंथुसियास्टिकली हमारे प्रोग्राम्स को फॉलो करती है और हमारा जो हर प्रोग्राम वो देख चुकी है इसके पहले भी, और हमारे साथ इसके आगे भी वो जुड़ी रहेगी। तो आज के हमारे इस प्रोग्राम में सवेरे से हमारे साथ जुड़ी हुई है डॉक्टर सुशीला हरियाणा से। मैं उनको आमंत्रित करना चाहूंगी। मैडम प्लीज आप आपके विचार प्रकट कीजिए आज के इस मौके पर।
थैंक यू मैम। Thank you to Ayush Darpan team for providing such a wonderful platform, and all speaker gave good and productive talk on their respective topics. Hello, ma'am, am I audible?
Yes, you are audible.
And I bow to all seniors and experts because हम तो अभी बच्चे हैं, आप हमें रास्ता दिखा रहे हैं सर। And I feel blessed and honored to interact with you all. और मुझे बहुत अच्छा लगा आपका ये प्रोग्राम। डॉक्टर शीतल मैम give us the importance of yoga for everyone, especially for student, and Dr. Harshla ma'am explained very well the role of yoga in post-COVID scenario. Also, she mentioned the therapeutic uses of different asanas and different positions of there, and excellent role of pranayam in treating post-COVID patients. And she also highlighted the importance of dhyan in light of her research work. Dr. Neeru Nathani ma'am, she gave importance to Nidan Parivarjan and importance of yoga in case of metabolic disorders. And she gave a good description of general patha and apatha, and she also highlighted the importance of prescribing the कि हमें डाइट चार्ट भी देना चाहिए to our patients. And she also highlighted the importance of Ashtanga yoga, especially yam and niyam and meditation. Then Dr. Vinita Sharma ma'am, she beautifully explained the Maun meditation, and I was thinking that it would be a talk of ek chup so sukh, but it turned into very adhyatmic talk, and it was a wonderful content, ma'am. And rightly, Sheetal ma'am rightly said that simple to understand but hard to practice. Then Dr. Ravi Raj Pardesi on Panchmay Kosh, Panch Kosh. It was very a new topic for me because it gave us the deep incitement of body and beyond body, thinking beyond body. हम सारे कोश को जब देखते हैं, हम तो अभी जैसे बॉडी को एक बस अपने अन्नमय कोश और प्राणमय कोश की तरह से ही देखते हैं, but it give us the insight of deep knowledge of beyond body. And then Dr. Jaya Jani ma'am, importance of yoga and pranayam, and Dr. Vasudha Paliwal ma'am on the code of conduct and different science, different international जो साइंसेज उन्होंने बताई. एंड लास्टली मैम डॉक्टर जया मैम जो उन्होंने रिलेशन बताया योग एंड आयुर्वेद का, इट वाज वेरी गुड. एंड डॉक्टर सुभाष चंद्र सर, आपका वक्तव्य बहुत अच्छा लगा हमें. आपने थोड़े से टाइम में ही बहुत अच्छे से समझाया कि प्रज्ञापराध और चित्तवृत्ति निरोध जो हम बोल देंगे अपने पेशेंट को, एग्जाम्पल भी दिया आपने पाइल्स के पेशेंट के बारे में. एंड इट वाज वेरी गुड सर एंड गुड. Thank you, sir. And thank you, ma'am. Thank you, Sheetal, ma'am.
Thank you, Sushila, Dr. Sushila, for sharing your perspective on today's program. बहुत अच्छा आपने दिल से अटेंड किया हुआ प्रोग्राम है मैम. हमको बहुत खुशी मिलती है when your delegates like you have joined all the way from Haryana and you have taken keen interest in our each and every lecture, and you have concentrated on many aspects of the lectures, vivid aspects. So thank you so much for being here. And जैसे कि वार्ष्णेय सर ने कहा था, और प्राइम मिनिस्टर ऑनरेबल डॉक्टर मिस्टर नरेंद्र मोदी जी is the key person की जिनकी वजह से we are able to celebrate the yoga day internationally. So जान है तो जहान है वाला अगर फंडा हम सभी लोग क्लियर समझ ले, तो nowadays it's a need of the hour to practice yoga to maintain मेंटल एज वेल एज फिजिकल वेलबींग। और इसी के चलते 177 कंट्रीज ने हमें यूनाइटेड नेशंस जनरल असेंबली में सपोर्ट किया था। इट वाज लाइक एन मीन्स निर्विरोध जिसको कहते हैं, ये डिसीजन लिया गया था। एंड इंटरनेशनली हमारा जो योगा डे का प्रपोजल था प्राइम मिनिस्टर मोदी का, वो एक्सेप्ट हुआ था। सो दिस इज अ वेरी वेरी एक उपलब्धि है हमारे लिए। एंड ये 7वां पुष्प है जो we will be celebrating the 7th International Yoga Day tomorrow, and on the eve of 7th International Yoga Day, we are celebrating this international web conference, which is jointly organized by Datta Meghe Ayurvedic Medical College, Nagpur, and Ayush Darpan today in the form of this international web conference. So in the series of expert remarks, I am calling upon Dr. Madhavi Nagrare here, who is an academician, researcher, and pursuing her doctoral research nowadays. And she is associate professor at Shalini Tai Meghe Ayurvedic Medical College, Bhandara. And she is here with us since morning, and she is associated with our events on Ayush Darpan, and had been a part of guest speakers in our PCOD mega event, which was held in Navratri last year. So I call upon Dr. Madhavi Nagrare for her expert remarks.
Hello, ma'am.
Hello, hello. Yes, yes, you are audible.
My video is not on.
Yeah, yeah, you cannot make, yeah. Welcome, Dr. Madhavi.
Thank you, ma'am. Thank you for giving my introduction. I am very thankful to you. First of all, I will pay my regards to respected Dr. Varshney sir, who is Guru, and after his giving an expert remark is a very different thing for me. It's an honor for me. So, सबसे पहले I would like to thank the auspicious and very well-known and profound knowledge-based Ayush Darpan Foundation for organizing this mega event, or I must say a very, very good, what an amazing day. Throughout the day, I couldn't move from my place, man. Actually, this is, I'm saying this from the bottom of my heart. What were the topics? The topic, on the occasion of 7th International Yoga Day, all the eminent speakers have mentioned and given lot of knowledge in a very simple and short way, and I am so glad that I have got chance to be the part of this so nice webinar, international webinar. Yes, I must congratulate to respected Dr. Naveen Chandra Doshi sir for giving and providing this platform to all of us throughout the pandemic of this COVID-19. You have been the person, the dynamic lady, the guide, the motivator, and I don't have words for you, ma'am. The way you have organized so many lectures and the series on surgeries at different topics, you have taken a lot of efforts to give us a knowledge base throughout this pandemic. So I'm very thankful to you, ma'am, and to Dr. Naveen Chandra Doshi sir. This Yoga Day event, which is the 7th International Yoga Day, and this Yoga Day celebration we are doing on the eve of this International Yoga Day in collaboration with Datta Meghe Ayurvedic Medical College. So I'm very much thankful to Dr. Harshala ma'am, Harshala Rajurkar ma'am, who was the first speaker of today's lecture series, and she has mentioned so many good things, out of which she has given some key points, the post-COVID management, and which is very beneficial and very important for this era. Throughout the treatment procedure, we take care of the patient, but post-COVID management is the most important thing. And regarding that post-COVID management rules and regulations, she has given a very nice and easy methods of meditation and asanas and the posture she has mentioned, and very nice and elaborative talk as per post-COVID management, ma'am. Thank you so much, ma'am. Harshala, ma'am. Then after that, Neeru Nathani, ma'am. Yes, silence speak. Neeru Nathani, ma'am, has given her talk on metabolic syndrome and so many patya, apatya, nidan parivarjanam, and many management things in hypertension, then vihar, nidan parivarjanam, patya, yoga, so many things she has described. I'm very thankful to her also. The diagnostic criteria she has mentioned in very short but very important factors she has mentioned, and which are the important factors one practitioner should consider, or which factors should be taken into consideration. She has mentioned very nicely. And next, Dr. Vanita Sharma, ma'am, the interpreter from Australia. Yes, Maun, the silence. Silence speaks more louder than words. So it is very important throughout the management of COVID patients, and I must say, the post-COVID management. Means it's not the responsibility of that patient, but the patient's family and the surrounding people who is taking care of that particular patient. So the threefold ramifications which he has explained, that buddhi, mon, ahankar, mon, ichha, mon, indriya, mon, and so many things she has elaborated very nicely. So only saving up the our leaves is not silent. Saving up your heart, your mind is actually a acquainting or adopting the silence. So again, I'm very thankful to Dr. Vanita Sharma ma'am also and Neeru Nathani ma'am also. And next, amazing talk by Dr. Raviraj Pardesi. He was my colleague. He is my senior, and the topic he has described, the practical insights from Panchakosh. What an amazing topic. Earlier, I was only thinking or looking towards that topic, like sale and all the other factors related to that Panchakosh. But the 5 layers Dr. Raviraj Pardesi has described was amazingly opened my mind. Yes, these are the views in from which we can, or an academician can or must watch towards this Panchakosh aspect. The way he has explained the Pranamay Kosh, Manomay Kosh, then Vijnanmay Kosh, Anandmay Kosh, and Annamay Kosh was amazing, sir. Really, I would like to congratulate you, sir, for explaining and giving us another view and vision to gain more knowledge about this Panchakosh aspect. Thank you again, Dr. Raviraj. Then Dr. Vasudha Asutkar Paliwal ma'am, which is a junior to me, but she has explained the topic karma, the code of conduct, and with respect to the concept of arogya in different aspect, in different systems of medicine, like Stova Rigpa, that is holistic view, then Korean and Oriental medicine, Mongolian medicine, Siddha system, Unani system, and traditional Chinese medicine. He is a very good academician and a very brilliant student earlier, and now a very brilliant academician, and giving and motivating her knowledge, giving her knowledge to her students as a guide. So again, very much happy to have all these eminent speakers here. Again, Dr. Jaya Jane ma'am, because of which Jaya Jane ma'am has given us a brief explanation about the importance of yoga, pranayam in this contemporary world. And of course, Dr. Jaya Daptardar madam, who has given her views on yoga and Ayurveda. So I'm very thankful to her also. Nowadays, yoga, Ayurveda is it should be the way of life actually. So again, I congratulate you, ma'am, to the organizers, to Harshala ma'am, and to Dr. Naveen Chandra Joshi ma'am to give us this knowledge base, and a very happy Yoga International Day. Thank you so much, ma'am, to give me a chance to give my remarks. Thank you so much. Dhanyavad.
Thank you, Dr. Madhvi, for being
Yes.
here and for expressing yourself. Straight dil se remarks from yours, I have appreciated a lot, and thanks for being with us.
Okay,
Thanks
thank you.
again. So this is the marathon events today we had with us in this program of International Web Conference on Yoga Therapy various aspects, and we are in the last phase of the conference now. May I call upon Dr. Vasudha here? Actually, today she was a guest speaker with us, but then she is a part of Ayush Darpan family, and I would like to call upon Dr. Vasudha to give the vote of thanks to formal vote of thanks in this program of ours. So, Dr. Vasudha. Dr. Vasudha.
Hello, am I audible, madam? I'm here.
Yes, you are audible.
Yes. Thank you so much, ma'am, for giving me this responsibility and considering me as a family member of Ayush Darpan Journal. Definitely, even though I'm a guest speaker today, I do not consider myself as a guest because I'm indeed a member of Ayush Darpan family, as I'm here always, and I wish I could have more chances of coming here on this platform to express my views. Okay, good afternoon, everyone. First of all, it's my pleasure again to thank again the organizers of today's webinar, the Ayush Darpan Foundation and Datta Meghe Institute of Ayurveda, Nagpur. This webinar was on multidimensional aspects of yoga, and this webinar expounded the aspects of practical and spiritual aspects of Yoga Darshan. I'm genuinely thankful to respected Dr. Naveen Chandra Joshi sir for this beautiful webinar, Dr. Sheetal Asutkar madam. I'm very much thankful to Dr. Sheetal madam for such a well-organized conduction of this webinar. I am very much thankful to Dr. Sagar Ji Meghe sir and Dr. Ravi Ji Meghe sir for allowing the conduction of webinar in coordination with Datta Meghe Institute of Ayurveda, Nagpur. Special thanks to Principal of Datta Meghe Institute of Ayurveda, Dr. Harshala Razurkar madam, for her cheerful contribution today. A very big thank you to all the eminent speakers for sharing their expertise on today's platform with such a dedication and simplicity. I'm very much grateful to respected Dr. Subhash Chandra Vashne sir for his illuminative guidance, and very rightly said by Dr. Sheetal madam as a master stroke always. Thank you, Dr. Madhavi Nagrare madam and Dr. Sushila madam for giving visionary remarks today. Thank you, one and all.
Thank you, Dr. Vasudha ma'am. And again, as an organizing secretary of this event, I would like to thank our management, especially Shri Sagar Ji Meghe, I should start from Shri Datta Ji Meghe, Shri Sagar Ji Meghe, and our very own Dr. Shri Ravi Dada Meghe for allowing us to collaborate with Ayush Darpan and present this event, which is now very highly appreciated as we are getting the remarks in our chat box, and then our deep sense of gratitude I have for all of them. As a management, they are very much encouraging, and at the same time, I am very much thankful to our principal, Dr. Harshala ma'am, for encouraging and supporting us to arrange such a mega event, and very short, in a very short duration, we have arranged this event, but it has been more than expectation. I have got the registrations which are very much abundant. So more than 450 registrations we have got, and we have got equal participation on FB and YouTube also, and Ayush Darpan app also. And I hope this webinar web conference will be very much beneficial to the students, practitioners, academicians, and researchers. And in future, we would like to also collaborate with each other and give such international and national events, and collaborate with our speakers also. So thanks again to all of you for being with us today. And with this, I declare that with our chairperson's permission, we declare that this program is now over for today. Thank you. Thank you very much.
Thank you, ma'am.
Thank you, ma'am. Thank you.
Very well organized program and very good program.
Thank you. Thank you so much.
Yes, thank you, ma'am. Thank you, Sheetal. Very good program.
थैंक यू हमारे एक्सपर्ट्स को बहुत अच्छे रिमार्क्स दिए आपने, थैंक यू, बट इट वाज फ्रॉम द स्ट्रेट दिल से रिमार्क्स, वी हैव रिपोर्टेड इट लाइक दैट एंड थैंक्स टू ऑल माय स्पीकर्स.